Recording in progress. Recording stopped. Recording in progress.
Very good morning to all honorable members. Good morning to our stakeholders on the platform. Good morning to representatives of our portfolio committee, our support staff, all guests. It is now 9 o'clock. I would like us to start the meeting. However, I can only see Honorable Kanile, Dr. Leklape, and Honorable Chauke Adonis. Mr. Mdumisweni, can you just check whether we've got a quorum to start, please? I might have missed. Oh, I see Honorable Adams. Honorable Mabel has joined.
Good morning, Chair, honorable members and colleagues. Yes, Chair, we do have a quorum. We've got about 7 members now, which then allows us to continue to proceed with the meeting, Chair. Thank you.
Thank you so much, Mr. Mdumisweni. Colleagues, before you, we've got the agenda for this morning. We are having a stakeholder engagement. The agenda is as follows. It's opening, welcome, and tabling of the agenda and apologies. We've got Associate Professor Delanoy doing a presentation. Ms. Karabo Oza, I hope that's the correct pronunciation, from the Center for Child Law. Ms. Chelsea Williams, Prof. Gertrude Fester, Ms. Lisa Vetten, and Atini Magodla also doing a presentation this morning, whereafter we will have deliberations and closure. Although I do want to make a small amendment to the program, I think we will take. I see I was muted there for a second by the host. Honorable colleagues, this is the agenda before us this morning. I think we'll take 3 presentations, then we'll break, we'll have engagements after the first 3 presentations, and then we'll take the next 3 presentations. Can I see if anybody would like to adopt the agenda?
Yes, Chair.
Good morning, Honorable Polwane.
Yes, good morning, Chair, and good morning, members and our stakeholders. I want to move for the adoption of this agenda. Thanks.
Thank you. Thank you so much. I see the hand of the Honorable Megan Chauke Adonis.
Thank you very much, Chair, and good morning to fellow colleagues and also our stakeholders. I just wanted to highlight that when you were muted, when you were making your submission for an amendment or an addition, it was not clearly captured. Perhaps if you can repeat that, and then I will then move to second the agenda.
Thank you so much, Honorable Whip, for alerting me to that. I just saw a message coming on the screen that I was muted by the host, so I'm not sure where I was lost. I'm proposing that we take 3 presentations and we open then the floor for discussions, and then we'll take another 3 presentations. Currently, we've only got 1 slot for deliberations, so that was the only amendment I wanted to make.
Thank you very much, Chairperson. I therefore second the adoption of the agenda.
Thank you so much. Ms. Mdumisweni, can we please deal with any apologies?
Thank you, Chair. The apologies that we have received are from Honorable Spies, who's out of the country attending a conference. Honorable Peterson indicated that she won't be able to attend the meeting. And the last one is from Honorable Sotitsi, who has got an academic commitment, Chair. Thank you.
Okay, thank you so much. Can I check if we've got anybody from our department present this morning and whether they wanted to introduce themselves?
Good morning, Chair and honorable members. My name is Putima Bilebile. I'm from the Department of Women, Youth and Persons with Disabilities. And I'm responsible for advocacy and mainstreaming for the Rights of Persons with Disabilities branch. Thank you.
Thank you so much. I saw Emmanuel.
Yes, good morning, Honorable Chair, honorable members. My name is Emmanuel Khanaga. I am representing the youth development component in the department. My chief director, Dr. Benis Tlagala, will be joining as well. They are currently attending a cabinet committee meeting. Thank you.
Thank you so much. I also see Ms. Sukra Eli.
Good morning. I am Dr. Sukraj Eli, and I'm the Chief Director from the Disability Rights Branch at the department. Thank you.
Thank you so much, Doc. Okay. I think I also see the parliamentary liaison of the minister. Or she might have dropped out. Honourable members, again, welcome to this meeting. Very important stakeholder engagement this meeting. I would like to take the opportunity to thank all stakeholders for availing themselves this morning to be with us. Colleagues, we have, as a portfolio committee in the 7th administration, already dealt with critical issues. We've dealt, for example, with gender-based violence matters and the National Strategic Plan. We have focused on the exclusion of learners with disabilities from the education system. We've done oversight in KwaZulu-Natal. We have also focused on the sanitary dignity framework. Soon enough, we will also be meeting with Treasury. We do have a joint meeting coming up with the Department of Basic Education and Higher Education. We will also be having a joint meeting with the Multi-Party Women's Caucus. And so, of course, ongoing work as the portfolio committee is unfolding, but we have, as a portfolio committee, acknowledged that our mandate is very broad and that we have not focused on issues, well, we have not zoomed in really on the issues of young people, youth development issues, and also on persons with disabilities and disability rights. And so we will be embarking on an internal strategic session next week to define then our priorities and our key focus areas for the remainder of our term. But in preparation for this internal workshop that we'll be embarking on next week, we thought it prudent to engage with stakeholders and experts in the field of women, youth, and persons with disabilities. And so this morning, then, we are grateful that these stakeholders have joined us. And today's presentations will focus on our mandate, which is, of course, women, youth, and persons with disabilities. And the presentations that we will be receiving this morning will help us to better, of course, frame our focus for next week, but we'll also hear from experts in terms of their concerns and which areas of focus they would think that we as a portfolio committee should be looking at. We'll also be gaining some insights, and of course, then we will be able to better identify our priorities in next week's meeting. So this morning, then, our first presenter will be talking to us on youth matters, youth rights and youth development issues. And our first presentation will be from the Associate Professor Ariana Delanoy, and she's from the UCT. And she's a researcher at the South African Labour and Development Research Unit at UCT with over 20 years of experience. She completed her PhD in sociology at the University of Cape Town in 2008. And I would like to hand over to her this morning. You are most welcome, Prof. And thank you for your time this morning. And thank you for being with us. You have shared your presentation, circulated to honourable members, but I'm hoping that you'll be able to flag your presentation as well this morning. Over to you, Prof.
Thank you so much, Chairperson. And thank you, everybody, for giving me an opportunity to present. I know some of you, but I definitely do not know many others. So there might be some repetition for those who do know me and what I present, but hopefully I'll be able to give you a nice overview of what we currently know about the situation of young people in the country. Let me try and share my screen with you. Can I ask whether you can all confirm that you can see my presentation?
We can, Prof.
Wonderful. Thank you so much. Okay, I would like to start with situating the position of young people in the social wage package of South Africa, that will give us an idea of, and alongside of an idea of where in the life course this youth phase sits in particular. I'll talk a little bit about the social protection mechanisms that are in place for the youth cohort and across the life phase. And when we have that overview, it will be easier for us to then think about what departments are responsible for what component of youth well-being and at what stage exactly of their development. Because I think that is quite important for us to have some consideration for who within the state apparatus is responsible for these different aspects of youth well-being. So this slide provides us with a high-level overview of the life course, so starting from pre-birth all the way till old age and retirement, and it then will look at the components that are available through the social wage package. At the bottom here, what runs across the entire life course is a series of services that the state has made available since 1994 or has expanded upon since 1994. These are available either free of charge or heavily subsidized, and their aim is specifically to improve the quality of life for all and to rectify injustices of the past. So included in that is anything from the public healthcare system to the provision of RDP houses, making available access to basic services and welfare services. And as I said, that is meant to run across the life course. Then there are within that a number of interventions and services that are specifically targeted at subpopulations or different age groups within the population. Over the last 15 to 20 years, we've seen, rightly so, a stronger focus develop on early childhood development that's made up of a comprehensive basket of services that supports children from before they are born, because it supports the mothers during pregnancy, and it supports mothers and children through those early years of life and into the foundation phase. Then moving on from that to a slightly older age group, there is the child support grant. And also there's a combination of services, the child support grant or the foster care grant, depending on the situation of the children, which is available up until the age of 18 or 22, respectively. The National Schools Nutrition Program, the public schooling system, all of which is available through to adolescence and into the beginning of young adulthood. And then later on in life, the pension system kicks in when people reach retirement age. Until not so very long ago, we could see this social wage package kind of tapering off underneath this young adulthood and adulthood phase. That's the case in many countries, and that is because the understanding is that the assumption is that young people will move quite smoothly, especially having put these foundational building blocks in place, that they would move quite smoothly through the education system and into the labor market. Now, we know in South Africa that is not the case. We've probably all seen the release of the latest quarterly labor force survey data just released for the first quarter of 2025. And we know that young people do not move smoothly into the labor market. And I will come back to that later on in the presentation. This is quite important because this happens also at a stage in life where we know, those of us who are mothers in the room or parents in the room, we know that adolescence and young adulthood is a particularly difficult phase in life to parent and to guide, but it's also a particularly difficult stage in life for young people themselves. Adolescence means that these are young people trying to establish their own independent identity. They're trying to work towards an independent life. They're turning much more towards the peer group than the parent group. And so there's a range of difficult situations and complexities that come into play at this stage of life that we really do need to think about when we think about supporting young people through that particular phase in life. So this gap here, I said until very recently, because of course, what has been in place for a long time, but what has strengthened as well over the last 5 to 10 years is the basket of active labor market policies that is available within the country. And we can expand on that in more detail, but we may run out of time. But so just thinking about this at a very high level, these are interventions that actively aim to connect young people to employment opportunities or to improve their chances for finding a job. That is a very broad range, as I said. So that is a range of interventions that focuses on either the young person or the job opportunities or the possibility to start one's own business or entrepreneurship endeavor. So that includes things as the public works programs. We've just seen the new phase of the teaching assistant program kick in with the Department of Basic Education. It also includes job training, help with CV writing, and on the demand side of the labor market, it includes things as the wage subsidy. So the employment tax incentive that's meant to incentivize businesses to offer opportunities of a particular nature to young people. So it's a broad basket of interventions. It also includes the Presidential Youth Employment Intervention and the National Pathway Management Network, which really is a concerted effort from within the presidency to drive a more coordinated approach to solving for youth unemployment. And again, we can talk about that in more detail later on. And then introduced during COVID is the SRD grant, which is available from the ages 18 to 59, which wasn't available for that particular age group previously. Given all these efforts and interventions and all these resources that are going into the youth development environment, what is the state of youth well-being in South Africa? And I'm afraid I don't have a very beautiful picture to paint at the moment. 10 years ago, in 2015, so exactly 10 years ago, I was asked to work on this analysis of, okay, well, where are we? So we went and looked at what data we have available, and that's a first problem in the entire approach to youth development is we have data. South Africa is blessed with a range of national survey data sets collected by Statistics South Africa, but they don't necessarily all collect data in a consistent manner across the different surveys. And so we do have some gaps in our understanding. And also, and I'll come to that in a little bit more detail as well, they don't necessarily provide us with granular level details on how young people are doing at the sub-national or the sub-provincial level. And I'll come back to that just now. What we did when I was asked to look into this 10 years ago was we looked at the census because the 2011 census was the first representative national data set in 1996, was the first representative data set for the entire population that was conducted. And then that is repeated every 10 years, or at least it should be repeated every 10 years. There are some hiccups every now and then, as we saw in the time of COVID, where it was much more difficult to collect the data. But this was, at the time, the most reliable sets of data for us to have a look at, to see where young people, how young people had moved from just after the transition, so in 1996, to 15 years later in 2011. We looked at the youth population aged 15 to 24, and I know in South Africa we actually should be looking at up to 35. We've got that analysis, but it sits somewhere separately. So for now, bear with me, we'll talk about 15 to 24 in particular. And we looked at just a number of indicators that we thought were important in relation to this overview here of the package of services and support that is in place. So if we look at the proportion of young people that were living in informal or traditional dwellings, the left-hand bars here are the 1996 ones, the purple ones are the 2011 ones. So young people, among young people in the 1996 census, almost 38% were living in informal or traditional dwellings, and we see that that had gone significantly down by 2011. Similar, so for young people in the 2011 census. Similarly, we see an improvement in the access to a range of basic services, and we'll see that come back in the following slide as well. We also see, we saw at the time, fewer young people between the ages of 20 to 24. So we look at no matric, we only look at for 20 to 24 because we don't assume that a 15-year-old would have completed their matric already. We saw fewer young people not completing their matric. So that's a good thing. We had more that were completing their matric. However, what we also saw, and that was devastating at the time, was that even though we saw this improvement in well-being, we did not see an improvement or only a very marginal change here in the unemployment rate and in income poverty. When I was asked to present today, I thought really we need to redo this analysis. We've been talking about redoing this for the last decade. We were hoping to work with the Census 2022 data, but there are some concerns around the reliability and the validity of the census, and also we don't have all of the indicators available that we would like to look at. So we went and looked at the General Household Survey. It's important to bear in mind that we can't directly compare these results with these ones because, as I said, the two surveys approach data collection slightly differently. It's a different approach to sampling and to asking the questions. So there's no direct comparison, but it gives us an indication of the trends. And so we looked at the same variables that we had here in these more recent data sets. We see that this proportion of young people living in informal housing is has continued to improve significantly. The proportion of young people living in houses with no piped water has continued to improve. We see significant changes in the proportion of young people who are not completing their matric. So we have more young people coming through the schooling system with a matric. This is the devastating part. We see deterioration in the unemployment rate. So unemployment is higher than it has been in a long time. And we also do not see improvement in income poverty. So this is the proportion of young people living below the upper bound poverty line in the country. We can look at what is driving this, but we haven't had a chance to look at this in an enormous amount of detail, given the relatively short time to prepare for the presentation. But what we do know is that this proportion of young people living below the upper bound poverty line is driven by an increase across the race categories. What happens when young people do not move smoothly through the education system? And when I talk about the education system, I talk about the different pieces of the pipeline, right? So we've got basic education, and then we have various routes into post-school education and training. So when young people do not move smoothly from one part of the education system into the next, or cannot find easy access to the labor market, we end up with a large proportion of young people who are not in education, employment, or training. All of the research in South Africa and globally shows that this is a cohort of young people that is particularly vulnerable to remaining trapped in poverty and to having lower mental health outcomes. So we see higher levels of depression and higher levels of remaining stuck in poverty among young people who are not in education, employment, or training. This is an analysis SALDRO runs on an annual basis. So we use the quarterly labor force survey data for this, and we've been looking at this since before 2014, but I've just pulled this 10-year overview together. We have a group of between the ages of 15 to 24 of over 3.3 million young people across the country who are not in education, employment, or training. And this has increased over the past decade, has not gotten better. We want to understand what that cohort looks like in quite a lot of detail, because the better we understand the cohort, the better we can think about what kinds of intervention we should target at what type of young person. Let me explain this a little bit more. Often when I engage with policymakers and civil society even on this group of young people, the question is, okay, but where are these young people? Why aren't they looking for work? Why are they just sitting at home? Why are they waiting? When we look at what these young people tell us in the surveys and in the qualitative work, the majority of these young people is looking for work. So we have almost 50% of them unemployed. These are young people that say they are available to work, willing to work, and looking for work. We have an additional 20% of young people that say they are available to work, willing to work, but they have given up looking for work. They've become discouraged because of the many times that they have tried to look for work and find access to opportunities, but have not succeeded. There is about 30% of them that is what we call inactive in the labor market. That inactive state is mostly driven by caregiving responsibilities within the household or ill health. So really, we're looking at a huge cohort of young people here that is not finding access to opportunities and that is wanting to work. The majority of these young women are always slightly more affected by this than young men, and the majority of these remain young Black people. Surprisingly, and this comes out on an annual basis, and you can see the trend here over time, the vast majority of these are young people who are living in urban areas. That's possibly driven by the fact that young people move to urban areas in search of opportunities. But so it's not because a young person lives in an urban area that it would be easier for them to find access to the labor market. The slightly older age group is always more represented because among those of the 15 to 19-year-olds, there is still more of a connection to the education system. This here at the bottom is quite a concerning picture. It corroborates what I showed in the previous slide, that more young people are completing a matric and are connecting to some form of tertiary education. But what we see is that in the past decade, while for a long time having a matric had a protective factor for young people wanting to access the labor market. So having a matric made it easier to some extent for some young people to find a job opportunity. What we're seeing now is a much larger representation of young people with a matric and a marginal but still significant increase of those with some form of tertiary education in this cohort of young people who are not in education, employment, or training. So we have more young people getting through the schooling system with a matric, but we're also seeing them now more represented in this cohort of young people who are out of education, employment, or training. We may think that this is just about that transition phase of leaving the schooling system and wanting to access work. But when we dig into the detail here, really what we see is a significant amount of young people who are long-term unemployed. And these are searching unemployed young people, right? We've got close to 50% of them unemployed for at least a year. And we break this down in more detail in the analysis. There is a significant proportion of young people who are unemployed, searching for work for 3 to 5 years and even more. This has to mean that we think about what we call the scarring effect on young people. The longer young people remain in that situation, the higher their chances for eventually becoming discouraged job seekers and simply giving up. But I'll come back to that in a little bit more detail just now as well. What's also important, again, when we think about the interventions for these young people, is that the vast majority of them, of those who are searching unemployed, are new entrants into the labor market. This means they've never worked before. Okay, so they do not have job experience to help them connect to the next job opportunity. There's a lot of numbers I'm throwing at you. But the reason why we dig into so much detail into trying to understand what this cohort of young people looks like that is living in poverty and unable to connect to a job opportunity is because we know that the consequences of living in what we call various types of deprivation are a cycle that our colleagues in psychology refer to as social causation and social drift. It really is a vicious cycle whereby young people and people living for extended periods of time in a situation of high levels of stress, a sense of social exclusion, the inability to look after themselves and transition into a state of independent adulthood feeds a cycle of mental ill health. And we see this in other data sets. We have incredibly high numbers of young people with depression and anxiety and other types of mental ill health, which means that even if an opportunity would be available to them. Oh, wait, I want to go back. there we go. Even if an opportunity would be available to them, they would not be in a good position to take up the opportunity. So really what we need to do is begin to think about how we break this cycle so that it doesn't continue to be a cycle of socioeconomic exclusion. How do we begin to solve for this? I think one way in which we've tried to position this for a long time now is for people and policymakers and departments to begin to think about deprivation as a situation of multiple interconnected dimensions. So we saw the high number of young people who are living in income poverty. That is not a situation that stands on its own. Income poverty impacts the kind of education young people can access. And while we see more young people coming through the schooling system with a matric, that number does not indicate to us what the quality of that matric is and the quality of skills that young people are leaving the schooling system with. Other studies are showing us how difficult it is for children to learn to read for meaning, for instance. So what then is the skill that young people leave the schooling system with? When we have young people who are accessing lower quality schooling, we know it is more difficult for them to access post-school education or training. That inevitably feeds into higher difficulties of accessing employment opportunities. But we know that income poverty also directly influences this, because we know that for many young people, the cost of even searching for a job is prohibitively high. And then we're talking about the cost of transport, the cost of data, the cost of printing, the cost of trying to access services that are going to turn them away and that are not available to help them. This income poverty link has a direct connection to unemployment, and one that is feeding through these other interconnected aspects. This entire situation also means that young people and people in general often live with poorer health and lower levels of safety, in families that are struggling to keep their heads above water and therefore to look after one another, and so on. So all of these aspects of deprivation feed one another and continue this cycle of exclusion. So when we think about solving for this situation, and this is a conversation that I see Emmanuel is on the call, and we haven't spoken in a long time, but this is a conversation we've had with the department for a long time, and I know there is a thorough understanding of this complexity. But when we think about the situation of well-being as one where all these aspects are interconnected, we really need to find a way to sufficiently and comprehensively support young people. Currently, while there has been an effort within the Presidential Youth Employment Intervention to approach things in a more comprehensive way, not every department that has a responsibility towards youth is represented in the PYI, and not every department that has a responsibility for youth well-being thinks about the other type of deprivation that plays out in a young person's life. So we really need to think about how we better streamline this policy context. There are attempts to move towards integration, but really there remains a large degree of fragmentation where, for instance, the Department of Social Development thinks about the social grant system, but hasn't and understands the connection to other parts of well-being, but hasn't necessarily been able to actively put in place a more comprehensive approach where, for instance, the social grant system would be more closely connected to labor market support for young people. Similarly, the Department of Health really has a role to play in supporting the well-being of young people so that they are able to take up opportunities, both education and training opportunities and job opportunities, but that integration does not exist. There isn't necessarily the thinking about how these connections, these linkages can be built more strongly. We also, when we work with young people on the ground in the communities, often run into a situation where young people don't feel that the service provision environment is one that is supportive and that is easy to understand. So we need to think about both building the evidence base on how we understand youth well-being and streamlining the policy context so that ultimately we move towards multifaceted, integrated, and evidence-based interventions. I'm going to pause for a moment because I'm conscious of time and I have more to talk about, but let me just stop here for a second and do a time check and see whether you would like me to continue for 5 minutes or whether we stop here. I think this was at least an introduction.
Prof, you can continue for another 5 minutes.
Okay.
You're well within your time. Thank you.
Pleasure. In that case, I'm going to stop sharing for a moment and take us to another platform that I would like to share with you. Because when we think about building the evidence base, it really is about building a very granular evidence base that would help us understand how young people are doing, not only at the national level, because the national numbers hide a lot of deprivation that lives at the more local level, and that more local and sub-provincial understanding really is crucial for helping us decide where to allocate resources and what kinds of resources are more needed than others. So what I'm showing you here is a platform called Youth Explorer, which maps a series of indicators on youth well-being from the national down to the subnational and the community level. Again, we're quite restricted in terms of the data that we have available. So what I'm showing you is Census 2011 data. It is outdated, and we will be working on finding other data sets that we can bring on board. But I just want to illustrate the gist of what we're trying to get to. So if we, continuing this conversation on young people who are not in education, employment, or training, we can ask the portal to map for us what the distribution of young people who are not in education, employment, or training looks like across the country. You can hover over this and you can see both the total number and the proportions of young people who are NEET. And you can see provinces like the Western Cape and Gauteng always doing better than the other provinces, but we can also zoom in by clicking on the map to the sub-provincial level and even the sub-district level. So I'm just quickly going to the city of Cape Town to illustrate the situation. We saw that as a whole, the Western Cape and the city of Cape Town are performing better than some of the other provinces like the Eastern Cape. But when we go down to the sub-district level, we also see areas with high concentrations of young people who are not in education, employment, or training, right? So we see the city center doing better, but the township areas going out from the city center towards the airport and beyond, having much higher concentrations of young people, up to 47 to even 50% of young people, and that's on a relatively small geographical area. What we want to get to then is a complete understanding of the situation of young people in those areas. And so we can also ask the portal to show us the proportions of young people who live in income poverty, for instance, and then you can begin to see where this multiplicity of deprivation is concentrated, and it remains very much in this area of townships out here. We can, if we go back to the NEET variable, we can then ask ourselves, okay, well, what services are available for young people? And this is really almost a call from our side to the various departments to work with us to make it possible to visually map where their services are located and what services are being provided. Because when we are able to do that, we can begin to see where the gaps are. For instance, we have worked really closely and really well with both the Department of Employment and Labour and the National Youth Development Agency, who have shared their national data sets with us and have given us the information on where their service points are available and what services they offer. That means that when we have what we call a heat map like this, where we can see the proportions of young people out of education, employment, or training are high here, so the need for support is really high here. But when we map then where the Office of the National Youth Development Agency is, we see that it's in town. And that is a problem because for many young people living out here, it is costly to make their way into town. And it is also not always certain that they know exactly what the requirements are to be able to access the support that is offered at these offices. The NYDA is not the only office that is meant to offer this kind of support to young people who are not in education, employment, or training. So is the Department of Employment and Labour. And so we can also overlay this heat map with those service points, and you can begin to see a better spread between the two for young people to access these services. But we still see pockets here where there aren't necessarily service points available. And we also see that while there are fully operational labor centers in some of these areas, in other areas, I need to go here. Sorry, it's a bit of a, here we go. In some of these areas, we're looking at only a satellite office, which means it isn't necessarily open the whole time, and it doesn't necessarily offer all of the information or all of the support that other offices would offer. So we would need to have a look and see what it is that young people can access there. I'm going to stop here because I can continue talking, but I really think that this is, I'm scratching the surface here of the kind of information we have available on young people and on service delivery for young people. It's a complex situation and a complex conversation, which, you know, I really would like to invite everybody to engage in at a larger level and for a much longer period of time collaboratively, so that these different aspects of well-being can be supported by the vast set of interventions that exists at the state level, but that don't necessarily all talk to one another. So let me just pause here. Thank you.
Thank you so much, Prof. We really do appreciate your presentation. I think it's quite a sobering presentation, and we agree with you that there needs to be more of a sustained focus on youth issues. And I think it underscores again what this portfolio committee has been saying, that we've got a lot of work to do considering our mandate. But I think the theme or the suggestion from your side that we need to work together collectively is a good one. Also, just on the issue of the NYDA, I think this Youth Explorer tool is very important, and I think we'd like to explore it some more because it could guide our work. But also with regard to the NYDA, we have been engaging with them and driving the point of how important it is for them to be accessible to rural communities, to expand its footprint, so that people that really do need their services are able to access those. For example, we've even made the suggestion around them using some of these government mobile trucks in order for them to reach young people. But of course, as you suggested, it's not the only solution. But thank you so much, Prof. We look forward to engaging with you in future. And please do stay online, as members will be able to engage with you in a little bit. We will now move our attention to disability rights and ask Ms. Karabo Oza, I hope I'm pronouncing the surname correctly, from the Centre for Child Law at the University of Pretoria. Karabo is the director of the Centre for Child Law. She's also a lecturer in the Department of Private Law at the University of Pretoria. She lectures undergraduate and postgraduate courses in child law, social welfare law, education law, children's rights in Africa, as well as human rights. Over to you, Karabo, and thank you so much for joining us this morning. We look forward to your presentation and gaining some insights from you.
Thank you so much, Chairperson. Good morning to all members of the committee as well as other stakeholders. Thank you for the opportunity to also share our thoughts, particularly focusing on access to education for children with disabilities. So just the presentation. So my presentation this morning will be really focused on two recent submissions we made in relation to access to education for children with disabilities. One submission was to the UN Committee on the Rights of Persons with Disabilities. And then the second one is a recent submission to the Law Reform Commission, which we know is undertaking the process of domesticating the UN Convention on the Rights of Persons with Disabilities. I will also, as I'm sharing my presentation, give real-life examples of the current challenges in the space based on the work that we do at the Center for Child Law. We engage in advocacy litigation and work a lot recently with organization that represent parents of children with disabilities, who've been doing work in this, in their communities for a long time and came to us with various challenges. So I'll also give those real life examples so that we all really see that this is not just about, the gaps in the law, but also reflect about what it means for people in their day-to-day lives. So by way of starting, I think we might all already have seen these statistics that for some years now have been shared around and even shared by the Department of Education in relation to the number of children with disabilities that may be out of school. It may be that the number has become more, a bit less, but as you'll see later, one of the challenges that we highlight in relation to the space of education for children with disabilities is that there is a need for more concerted effort to gather data and to have disaggregated data that can help planning. Now, this, when you look at the stats, obviously you would be concerned because that's quite a sizable number. And more so because we all say that the right to education is immediately realizable for all children. But when you engage with the parents, when you engage with the community in the disability space, you will see that that is not a lived reality of many of their children. And if anything, there are people who've even aged out of the system, have become adults legally without having even accessed education. And I'll come back to this point a bit later. So what are we seeing, what is there and what will we seeing as challenges? So let me maybe start with the legislative framework. We know that most policies in relation to provision for access to education for children with disabilities, apart from obviously we have the Constitution section 29 saying there's a right to basic education, but there's quite a number of policies, regulations and guidelines that have been adopted over the years in relation to access to education for children with disabilities, including, as we all know, the White Paper 6. But these documents are challenging because some of them, as we know, are outdated. When you look at them, they're very fragmented. And the reason I'm saying this is we currently busy looking at most of these because we have been approached to assist the community in the Northern Cape in relation to access to education for children with disabilities. And when you look at them, you see that White Paper 6 came into operation. Then there was the development of the CS policy in relation to, the assessment and placement of children with disabilities and providing them support. But since the CS policy, some of the other guidelines that are there were never reviewed. And also when we engage with the people in the sector, we realize that some of these are not even being followed. Some of them actually do have positive provisions that if they were implemented, they will make a difference, but they are not being implemented. So as I said, the framework is particularly a problem in that you also don't find all the all the regulatory framework in one place. You have to be looking all over the place to find what applies, what provides for monitoring, what provides for infrastructure, and then more importantly, then the placement and the supports that need to be provided when children are eventually then placed in schools, and what support they should get there. So in terms of then building again from the legal framework and what the intention was and still is, we hope to a large extent, is that there were provisions made or there are provisions made that there should be access to education for children with disabilities through these three approaches. So ordinary public schools, meaning that we are providing for inclusion. Obviously, they means then that you have to then provide the support that child that you are then placing in the ordinary public school, you're going to then give them the support. Full service schools. Full service schools are the schools where there's supposed to be a concentration of resources to actually enable children with disabilities to be supported, to actually then be able to engage in schooling in a way that also maximizes the outcomes for them. And then lastly, then the special schools. And all these we know fall under the Department of Education. And I want to just maybe go on again on the issue of full service schools. So, I mean, these schools, as we said, were intended to serve as an example of good practice, to chart the way forward for all schools and become inclusive institutions. And the target that was set by White Paper 6 was there should be 500 full-service schools, which is about converting 3.6% of ordinary public schools into these schools. But what has happened is this. So in 2019, the AG report indicated that 77% of education districts were either not sufficiently resourced or that districts did not have plans in place to support full service schools at all. Then that means that 79% of schools lacked adequate resourcing in terms of infrastructure, assistive equipment, and funding to constitute functioning full-service schools that are fit for purpose. And I want to here give an example. We went to the Northern Cape where the Human Rights Commission has been working with the community there, the parents of children with disabilities, and had tried to already write letters to the Department of Education in that province about the plight of the children who are on waiting lists and the fact that they is a full service school that is not really functioning well. And we went to visit that school. Our team went to spend a couple of days there, and the lived reality is the fact that there isn't enough infrastructure, there isn't enough assistive, devices and stuff. And that means that in the end, the school will not take on the children that needs to be placed because they won't be able to provide the necessary service. So that is something that as recent as last year is a lived reality that the full services school model is not taking off, not only in the Northern Cape, we also are aware we had a case in the Northwest where we assisted a child and their parents. So that is a challenge that is still there. Just again, in terms of the statistics, you see that in that AG report, it had stated that 121,500 children with disabilities were in ordinary schools, 119,500 were in special schools, and 11,500 had been placed on long waiting lists. Now, the stats are probably outdated, and as I said earlier, there is an issue about the stats. The waiting lists are a serious problem. The waiting list is something that is across the country a challenge. I think there is a recent judgment from the Western Cape where Equal Education Law Center was bringing a case about learner placements. And in that application of theirs, the court application, they also touch on children with disabilities and the issue of long waiting lists and actually the lack of a proper plan to approach as to how those children will then be placed in schools. And I think in the beginning, I started by saying that, there's an issue about these waiting lists that even some children end up aging out of the system without having access to education. And we've seen that again in the Northern Cape. There are some parents who came to the meeting where they had telling the story of how for the past 10 years they've tried to find a way to have their children be placed in some form of education. And now those children have become legally, in terms of the law, adults, and they never accessed anything in terms of education. What we also found in relation to this, that is something that is also concerning, is that, for instance, in the Northern Cape, some parents who had a bit of means then decided to start their own kind of private education centers to try and at least keep children, stimulated and give them some basic education. But as you can imagine, with the current challenges of socioeconomic issues and finances, not a lot of parents can actually afford that. One of the things that we've seen or in relation to the challenge in this area is the issue of spending. And the fact that there is underspending in the area of access to education for children with disabilities. We've already touched on the issue of full service schools and how they lack the resources, and how there's also issues pertaining to schools in the rural areas. And here maybe I must also, remind us that we've seen even in the media where you find that children have to be in the hostels in order to access education, and these are children with disabilities, and those hostels that are attached to the schools do not provide proper care for those children. It's again an issue of funding and an issue of oversight, and really making sure that those children are looked after when they are in those schools that are most of the time far from home, because that's the only way that they can access an education. So we are here, 20 years, a bit more than after the white paper 6, and there are a lot of questions in relation to whether it has achieved what it was meant to be. We are aware that the process of reviewing has started, but I'm not really certain as to where that process is currently. But what is clear is that many of the targets of that paper remain met and will remain unmet if there is no initiative to include learners with disabilities in the planning, the budget, the implementation, and evaluation efforts by the Department of Education. And here, some of us have even gone as far as to start to do our own research in relation to looking at the policy, but also looking at the costing of education for children with disabilities. And for instance, our center right now is working with some economists to try and actually come up with a potential kind of costing model for a particular group of children with intellectual disabilities, and what will that model and what would that funding model will look like, because one needs to understand, there's a need to understand the needs properly and to then channel the money to actually ensure that you maximize the outcome for the children. I do want to mention that recently we were invited to a meeting where there is now a task team by the Department of Education to try and focus on children with disabilities and their placements, and reducing their waiting lists. But we will see, what that process achieves. But I just wanted to mention that we are aware of that. I think the presentation that was made by the first presenter, Professor, indicated quite a lot of stats. But what we see in the area of children with disabilities, or even persons with disabilities, that we have quite a lot of outdated statistics. And, this is something that is of concern, because if you don't have statistics that are current, then your planning, your allocation of budgets, and your allocation of other resources will not be adequate. So it's really very critical that there is an intentional effort to try and make sure that we do proper we gather statistics, disaggregated data for children with disabilities, and particularly focusing on access to education. Then I quickly want to move on to this current process that the Law Reform Commission is undertaken on domesticating the UNCRPD. So it's obviously the report, but attached to the report is a proposed bill. So we made submissions. I think it was end of last month that we had to make submissions. One of the things that we pointed out outright in our submissions is the fact that while we commend the fact that the CRPD is now being domesticated, a lot more could have done to cover the issues of children and to be more intentional about the needs of children. Just to mention, some things that are of concern when you look at the provision, the bill, it does look like here and there children were a bit of an afterthought, and some of the things that are concerning link with, particularly in education, link with where I started about the fact that the right to education in our country, to basic education, is an unqualified right. But in the bill, the approach to socioeconomic rights just blanketly says that these rights will be implemented in accordance with the availability of resources and all those things. So there's no nuance in thinking about how, if you domesticate a bill like that, you actually, to some extent, bringing a regression on or something that's already been dealt with sufficiently by our Constitutional Court, and has been made very clear that the right to basic education should not be subject to progressive realization, but also thinking about how, if we are so far behind for children with disabilities, if you now introduce that kind of provision, how you actually then it means that you are going to actually fall even far behind with your planning, because now you're going to say we don't have resources for them, so we have to wait. So just a few of the provisions that we made submissions on that are of concern for us. Just the domestication of Article 7, that is a general provision on children with disabilities. We feel that there could have been a bit more in the bill to actually cover what the CRPD intends in realizing the rights of children with disabilities. So there could have been more that is more specific. And granted that obviously this act will, once it's an act, will be read with the Children's Act and other existing laws on children's rights. But really there could be a bit more done to strengthen the legal framework, particularly focusing on things that we're already seeing as gaps in our laws. There's an inclusion of family and society, which is very fundamental for a child with disabilities development, we feel that a lot more could have said about this and how families are going to be supported, families of children with disabilities. Then lack of provision for full domestication of Article 24 on education. I mean, this is the main thing, and I've already mentioned the fact that the Act or the bill proposes a clause that is a bit regressive and subjecting the right to education for children with disabilities to progressive realization, and that's something that we must guard against, because in this space we already have a lot of challenges. So we also made it very clear in our submission on this that we have issues pertaining to the fact that there are buildings that are inaccessible, a lack of trained personnel, insufficient procedural accommodations for children with disabilities. And this is really based on our work that we've done. It's not something that we kind of dreaming out, but we have had to, a simple case of asking the school to build a ramp for a child with disability to be able to access the building. We've engaged with those. I've already touched on some of the examples about, full service school needing to accommodate children. One other thing that is not education, but is very crucial, is the issue of late birth registration for children with disabilities. And I want to mention this because in our report to the UNCRPD, we mentioned how in one of our cases, we had to really engage with Department of Home Affairs and force them to go to a child's house to get there, to be able to help the parents to register the child's birth. And, because the child has a severe disability and is not able to get to Home Affairs, but we actually had to fight. So again, thinking about also how in the other areas of our laws, we haven't really fully thought about how we accommodate children with disabilities and their families. And it had to take a lawyer's letter for the department to send a mobile truck to assist that family. How many other families are sitting with such a challenge and do not have access to their services? There's a need to promote community-based care, which promotes independent living and social interaction, and that will lead to better improved outcomes for children with disabilities. I was also thinking about Ariana's presentation about what we do with children, during that developmental phase. It's very important so that when they become, adults, they actually have some means to be self-sufficient. Otherwise, we're going to have a big population of persons with disabilities who can never do anything for themselves. And in that way, we're actually violating quite a lot of their rights. I've already touched on the issue of data. So in conclusion, in just specifically on education, what I wanted to say is that the full service school model, when you look at it, is actually not a bad model, but it needs to be supported properly. It needs to be funded so that it can work the way it was envisioned, and maybe there needs to be improvements here and there. The obligations set out in the minimum norms and standards for public infrastructure must be met. This is very, very important. And I want to mention, over the years, most of us have seen how the Human Rights Commission has had to have inquiries about, children with blindness being locked up in buildings and dying when there's fire because the infrastructure is problematic. We have the Eastern Cape case where children were sleeping on concrete beds and all those things. So there is a need to actually really engage on these issues of norms and standards for infrastructure. We need data collection methods to get data in a way that is disaggregated and can actually help us to plan. There must be an effort to include disability inclusive planning, monitoring, evaluation of infrastructure projects related to basic education in ordinary, special, and full service schools. One of the things that I think is very important is that everybody who has the power to an oversight role and oversight power should really take the responsibility serious and do visits to these facilities, like the Human Rights Commission now and then does and visits, and then you can see the lived realities of children with disabilities, so that we are informed by that when we, hold people accountable or when we make claims or advocate for better provision for them. Then this is just my last slide. We need to review policies and laws. I mean, I've already mentioned the fact that the CRPD domestication bill is really but an umbrella bill. But we have a challenge that in the space for education for children with disabilities, there's bits and pieces of laws and policies that are there, but there needs to be a clear effort to really try and see if they can be brought together into one place, but also that they talk to each other in terms of the support, and then the next step would be then to make sure that they are implemented properly. There also is a need for us, and we do that, to implement concluding observations from treaty bodies. Now, it may sound like, what is this? But I mentioned the UNCRPD process. The reason for us to domesticate that UNCRPD is because we are requested or required because we signed the treaty. And then we report to the treaty bodies. When they bring concluding observations for our countries, we must take them up and ask questions about, if the committee said that you must try and reduce the number of children with disabilities who are out of schools, the next reporting cycle, would you have done that? That means that there must be then that continued monitoring, so that when the government next reports, we're not, sitting with, oh, we don't know, but you actually are intentional about it, so that that report to the committee covers those issues. I put there that we need to have inquiries with families and parents of children with disabilities. This is very, very important. We've seen it, and it's, working in the space of disability requires a lot of work, a lot of intention. We've started engaging with the families. I think we've been to, for instance, to the Northern Cape twice or 3 times. You have to take time. You have to hear the families. You have to really put yourself into their lived realities to be able to understand. Obviously, the laws and policies matter, but we can't change them in a way that really addresses the situation on the ground if we don't understand the situation on the ground. And most of the parents and the people in this space really feel unheard, and there is need to focus on how we're going to hear them. And lastly, because I'm a lawyer and I do a lot of litigation, which sometimes people don't like, we actually engage in litigation on access to education for children with disabilities. And currently we have 2 cases where we're going to try and get court orders to go and visit some schools and see the conditions for children with disabilities. We did a case about the tax rebates, where our government wanted to take away the tax rebates of parents of children with disabilities on education who put their children in private schools. But we fought that because we said, for as long as the country doesn't have sufficient schools for children with disabilities, if parents have their children in private school, you must then provide those rebates for them. We're also working with the Western Cape Federation for Intellectual Disability, because they did the only really disability rights case access to education that was done in around 2010. And we are assessing whether since that judgment, what has been the implementation and what has been the kind of developments, and whether they're sufficient or whether there's a need to engage in any other form of litigation. And just lastly, tomorrow and Thursday, the Copyright Act cases in the Constitutional Court, where the President has submitted the Copyright Amendment Bill for constitutional certification. And some people would know that that act also includes the fact that there needs to be exceptions to copyright for persons with disabilities. For instance, Blind SA had done the Blind SA case to do that. But also we've got into that case because we're making submissions about how educational exceptions are very crucial, including for making sure that material can be reproduced in a way that is accessible for children with disabilities in schools. So I hope with that I've given you a bit of something to think about, and thank you for the opportunity, Chair. Thank you.
Thank you so much, Karabo. We really appreciate your presentation and your time, and thank you to you and the Centre for Child Law for everything that you are doing for our vulnerable children, and in particular children with disabilities. And I think we heard you loud and clear that we need to review policies and legislation, and that we need to do more oversight. In fact, you mentioned the issue of boarding schools or accommodation for children with disabilities. And when we went to KZN, we visited a school for the blind in Pietermaritzburg, and we found exactly what you had mentioned, a boarding school in a state of disrepair, which actually then, with regards to the maintenance not being done there, poses a threat to those learners with disabilities. But I think for this portfolio committee, we've already engaged with the portfolio committee on education, and we will be having another meeting with them on the 3rd of June around issues of learners with disabilities. But I think the mere fact that we hear, and it's a refrain that we keep on hearing, that children are on waiting lists, they cannot access education, other learners are completely out of the education system, but the mere fact that learners age out of the system, not being able to access their constitutional right to education, really should keep us all up at night. And that status quo cannot continue. And again, it just comes back to the issue of our mandate and the need for us to keep this as a focus area. But thank you very much, Karaba, and please stay online because members will be engaging with you after the next presentation. Thank you so much. And now it is my pleasure to ask Ms. Chelsea Williamson. She is an expert in disability rights. She leads Be Understood, whose mission is to create spaces, whether digital or physical, where accessibility is not just a requirement, but key to inclusion and equity. Ms. Williamson is the Deputy Chairperson of the PAN-SALB, South African Sign Language National Language Board. She's also the co-lead at G20, D20, Disability Workstream. She has a LLM in Human Rights and Disability Rights, and you are very welcome, Ms. Williamson. We really value your time this morning, and over to you. I hope you can share your presentation with us.
Thank you so much, Liesl. I'm going to go ahead. There we go. All right. Thank you so much, and good morning, honorable members. Thank you so much for the opportunity to speak with you all today. I'm here to speak on a matter that's very close to my heart, how technology can and must be used to support the rights of persons with disabilities. My name is Chelsea Williamson, and you've heard a little bit about me. I'm a proudly neurodivergent, autistic, ADHD, dyslexic, dyspraxic, and dyscalculic South African. That's quite a mouthful. I'm an advocate for disability inclusion, and you've heard a little bit about all the things that I'm involved in. My journey has always been rooted in breaking down barriers. Now, all of what you've heard about me is all great head knowledge, but my passion actually stems from a very personal experience. I was privileged enough to have been adopted by an incredible family at the age of 3, and I was fortunate enough to have traveled extensively, and I ultimately ended up growing up in Dubai, where I attended an inclusive school or a full service school, where I had access to therapy, qualified teachers, high quality education, and above all, technology. I never felt disabled until halfway through high school. We moved to South Africa, and I attended one of the top private schools here that ultimately ended up asking me to leave after just 3 months because they didn't know how to deal with me or my disability. This was the first time that I realized I was different, and I felt that discrimination. The next school we went to, we chose not to disclose my disability, which in and itself is a privilege and a luxury, out of that fear of being rejected again. This meant that I had to suffer in silence and struggle my way through school without any support. University was much easier thanks to the tremendous disability units that I attended. I went from being a student who was told I'd never be able to pass school to graduating 10% of all students in my university with 90% in my honors year. I ultimately got my master's in law, and my goal is to have my PhD in the next few years. This is all possible because of one thing: my access to technology. I bring this experience with me today to call for a greater alignment between our legal frameworks and the ever-evolving power of technology. So in today's short presentation, I'll be covering 5 key points: the evolution of mainstream technology for accessibility, legislative frameworks in South Africa and beyond, the future of AI and XR for persons with disabilities, why legislation must evolve to match technological process, and lastly, a closing summary and a call to action. So let me begin with this powerful quote. For people without disabilities, technology makes things easier. But for people with disabilities, technology makes things possible. This captures the heart of why this conversation matters. South Africa has made commendable progress when it comes to advancing inclusion. Women like myself now can finally vote, and we can contribute more meaningfully than ever before in the workplace. Persons of color are no longer confined to segregated schools or public spaces and are participating more and more equitably in all areas of society than before. Now, trust me when I say there is still so much work that needs to be done, but these gains reflect our country's commitment to human rights. However, the progress for persons with disabilities has not kept at the same pace. we continue to see segregated education systems in South Africa, where according to a survey done by the Human Rights Watch, and Karabo touched on these statistics too, roughly 70% of children with disabilities do not have access to any education. 14% are in segregated special needs schools, and 14% of children with disabilities are in general education schools. And the remaining children with disabilities are on long waiting lists and are often aging out of the system. We see this filtering into shockingly high unemployment rates amongst persons with disabilities. According to the United Nations Committee on the Rights of Persons with Disabilities, they estimate in their report that the unemployment rate for persons with disabilities in South Africa is at an alarming 98.8%. This is not a policy gap issue. This is a human dignity issue. Technology, if implemented with intention and inclusion, can serve as a powerful catalyst for change. It offers us tools to build a society where accessibility is embedded, not bolted on. A society where no one is left behind. So let's reflect briefly on where we've come from. In the past, persons with disabilities had to rely on siloed assistive devices or reasonable accommodations, like screen readers, C-pens, bulky magnifiers, large prints, scribes or readers, or thick, heavy braille printed books. These tools are essential, but they're often expensive, hard to access, and not compatible with everyday systems. Importantly, assistive devices are not an example of universal design. They often highlight an individual's support needs, which can unintentionally isolate them. Children with disabilities in the inclusive education system or adults in the workplaces often feel isolated because of them. These devices can make people feel othered or visibly different. In contrast, mainstream technology like smartphones, laptops, tablets, the same technology we use every single day, when designed accessibly, allow persons with disabilities to use the same tools as everybody else. This removes stigma, fosters dignity, and promotes true inclusion. Since 2009, smartphones have come with built-in screen readers, and this has continued to evolve. We now see features like voice-to-text transcription, eye tracking, sound recognition, haptic feedback, magnification tools, Zoom tools, and more built in for free in mainstream devices. Inclusive design has shifted from making things easier to making things possible. I want to show you a very short video with audio descriptions that was made in 2019 by Apple. Now, I want to be clear here, I'm not promoting Apple. I work across different platforms. However, this is such a beautiful story of a lady named Sadie. She's employed at Apple as a video editor. And I want you to reflect as you watch this video on what Sadie's life would be like without access to this very technology.
In a kitchen, we move to an open bedroom door. In the bedroom, Sadie Paulson is reflected in a mirror. A caregiver brushes her hair, then helps her into a blouse.
People think that having a disability is a barrier.
Sadie sits at a desk working with an iMac. She moves her head to operate switches on her headrest.
But that's not the way I see it.
Now, a young man uses sign language on a FaceTime call.
You can catch up with friends.
A young woman signs back as a family picnic.
You can capture a moment with your family.
One face. Small face. Focus lock.
A low vision man takes a photo with an iPhone.
And you can start the day bright and early.
A woman lies in bed using an iPhone app to open motorized curtains. She slides from her bed into a wheelchair.
You can take a trip to somewhere new.
A man hikes with friends. Now a close-up of his hearing aid. He stops to adjust its volume with an iPhone.
3 miles to the summit.
A boy uses an iPad in class.
You can concentrate on every word of the story.
A bird began to sing. Jack opened his eyes.
An athlete selects outdoor wheelchair workout on her Apple Watch.
You can take the long way home.
A beach at sunset. The athlete pushes her wheelchair aggressively down a paved path, quickly gaining speed. Then the footage rewinds, revealing that it's being edited in Final Cut Pro.
Or edit a film like this one.
We zoom out to reveal Sadie editing the film. She uses her head to use switch controls, navigating an on-screen keyboard.
When technology is designed for everyone,
She drags a clip and plays the film.
it lets anyone do what they love, including me.
Sadie laughs. Then a gray Apple logo appears on a white background. The logo disappears. So I'm sure you can all agree after watching that video that technology makes life possible. Sadie's life has been impacted by technology, and her story is one of many. Technology is making life possible. So now let's have a quick look at what the law says and the legislative backing that we have. South Africa already has strong legal protections for persons with disabilities, but there is definite work that needs to be done, including the need for a comprehensive domestication of the UNCRPD in a Disability Act, and we all know that that's currently in draft. We've already spoken about that today. So domestically, the Constitution, it guarantees equality and non-discrimination. PEPUDA reinforces anti-discrimination in practice. The white paper on the rights of persons with disabilities explicitly calls for universal design and accessible ICT. Regionally, we have the African Charter on Human and People Rights, which provides the foundation for equality. We have the African Disability Protocol, which was implemented only last year and is the first binding instrument specifically addressing disability rights in Africa. We have Agenda 2063, the Africa We Want, which recognizes inclusion as essential to development. Globally, there are several guiding conventions, strategies, and principles, including the UNCRPD, the UN Disability Inclusion Strategy, the GSMA, Principles for Driving the Digital Inclusion of Persons with Disabilities, the OECD, Principles on AI, and of course, the Universal Declaration on Human Rights, which is the foundation. So as we're looking to the future, we're now standing on the edge of a new digital frontier. AI, or artificial intelligence, refers to systems that can perform tasks usually requiring human intelligence, like understanding speech or recognizing patterns or making decisions. AI can generate real-time captions. We've got this on Zoom today. It can interpret South African Sign Language. It can provide conversational assistance for persons with communication or cognitive disabilities. AI personal assistants, which I use daily, can support and help support individuals with memory challenges or executive functioning disabilities in their day-to-day routines. I've used AI in a school for learners with autism in Soweto to help them practice social cues, conversations, and communication skills. Then looking a little bit further at extended reality, or XR, this is an umbrella term for immersive technologies like virtual reality and augmented reality. These tools can simulate classrooms without ever needing to be in the classroom, can simulate therapy environments or workplaces, help people practice for job interviews and social cues. It's all tailored for persons with sensory, mobility, cognitive, and even vision disabilities. I personally used XR when teaching children with disabilities in South Africa and rural areas. I would use it for them to learn about the human body using a tool called Virtual T, and they would be able to explore the human internal organs and see how it all operates without ever needing to actually see a physical human body. And there's so much more that you can do with it. But innovation without inclusion is exclusion by design. These tools must be co-designed with persons with disabilities from the very beginning. Otherwise, we're opening ourselves up to AI bias. So why must legislation evolve? What needs to change? First, we must update our procurement and infrastructure standards to require digital accessibility across all government systems. Second, we need to enforce mechanisms that don't just reward inclusion,
but we need to demand it. Third, we must offer incentives to tech developers and startups who prioritize universal design. And finally, we must protect the data privacy and digital rights of persons with disabilities, especially when they're using AI-powered tools. So just to highlight these points and how far away we are from inclusion, I ran an accessibility audit on Parliament's website. And the audit came back saying that the Parliament's website was not compliant according to WCAG, which is recommended by the United Nations. In fact, the audit scored that the website is only 10% accessible. And it's not just Parliament's websites, it's all government's websites. This means that any person with a disability requiring accessibility, including blind, low vision, colorblind, cognitive disabilities, physical disabilities, they cannot access our government websites. It starts at home. We need to ensure that public information is accessible, and it starts with you today. So to summarize, technology is no longer a luxury, it's a right. South Africa has the policy intent, but we need implementation and oversight. The future is here with AI and XR. We are in the fourth industrial revolution, but it must be built for everyone. Our laws must evolve to protect the rights of persons with disabilities in the digital era. As we move forward, let us hold fast to the principle that accessibility is not charity, it's justice. Thank you, and I welcome your questions.
Thank you so much, Ms. Williamson. Thank you so much for sharing your insights with us and your passion. We really appreciate that presentation this morning. I think we agree with you that laws must evolve, and we will be taking up the issue that you just flagged around the accessibility of government websites as well as Parliament's website. And I think really the very shocking statistic that you shared about the employment of persons with disabilities, or the unemployment rate, is really one of the reasons why we can no longer turn a blind eye to the fact that some government departments are not even meeting their minimum target for the employment of persons with disabilities. And we really need to do much more work in this regard. Colleagues, we're now going to pause, and I would like to take your hands just for some comments or questions to the first three presentations, please. Would anybody like to make any comments, ask any questions? Okay, I see three hands for now. Please, can we start with Honorable Kanyile, followed by Dr. Leklape, followed by Honorable Shabango.
Chairperson, if you can also acknowledge me, apologies. I did send a message in the group. I'm unable to raise my hand. It's Honorable Chauke.
Okay, perfect. So we'll start with Honorable Kanyile, Dr. Leklape, Honorable Shabango, Honorable Mabel, Honorable Pulwani, and then the last person will be the Honorable Chauke Aduanis. Over to you, Honorable Kanyile.
Good morning, Chairperson, and good morning to the stakeholders that we have within us, and to the greetings to the colleagues as well. Chair, I appreciate this opportunity. I'd also like to indicate that I live with a mother. My mother is speech and hearing impaired. I think it is one of the reasons I felt it's important to be part of this portfolio committee, where I can learn more and conduct an effective oversight on persons on persons with disabilities, as well as women and youth. Chair, I don't think I have a question. I'd like to acknowledge the presentations that we have received today, all three of them, and also acknowledge that the issues that they are bringing forward are issues that are very important. And some of the issues are issues that we have started to pay attention to as members of the 7th administration. The first presenter spoke mainly or largely on the issues of youth unemployment, and went as far as indicating that young people, they apply until they get to a point where they are discouraged because they cannot find employment anywhere, even if they move to urban areas. These are the issues that we pay special attention to as this portfolio. And the chairperson, as you have alluded as well, that we have raised these issues with the NYDA, because NYDA falls within our portfolio, where we have over time and time again emphasized that they need to also look at ensuring that they are accessible to young persons in rural areas, and not only to the young persons in rural areas, and ensure that they respond to each and every young person that reaches out to them, whether the response is positive or negative. But I think getting a response gives you comfort. Lately, I have been approached by young persons that are seeing my posts on social media regarding the NYDA. I try to forward them to NYDA. There is some progress. One can see that there is a willingness from the NYDA to respond. And I do believe that we are going to be able to conduct an effective oversight as soon as the board has been appointed, as we are awaiting the president to appoint the board now that we have concluded the interviews. Chairperson, I also want to go to the issues of learners, with access to education for learners with disability. This is a very important issue. I think if you will remember, I had an issue that I have brought before the portfolio of learners that were in somewhere in the East Rand, but it is in the Gauteng province. I don't remember the area. Learners with disability, they are still neglected, because even when they come to us and we bring these issues, I think because we are still trying to find ourselves as well within this portfolio and trying to find a working situation that is going to give us fruitful results. I think one day, or maybe before the end of this current term, we are going to be able to find a way where we are able to get the Department of Women, Youth and Persons with Disabilities to respond to us timeously on the issues that we are raising, because just as much as community members out there are sitting with these challenges, they also become our challenges more, especially when they are brought to our attention and we take them to the department and we wait for a lengthy period to get feedback. And it means it will take us a very long time for us to be able to reach out to each and every person with disability. I would like to urge you, Chairperson, to assist us as well to ensure that all issues that we send to the department, we are able to get responses and be able to provide feedback. Chairperson, I only have one question. I think on the presentation, I think that was Ms. Koza. At some point, she mentioned that there was a judgment on a certain case that she was working on. I want to find out if the judgment indicated by when, what the details that are on the judgment they needed to be complied with, and if she is aware of the current status. And following that, I also want to mention, Chairperson, to you that during the oversight that we attended in KZN that we had in March, there were various issues that were also raised by mothers of children with disabilities. And some of them, they interlink with the issues that we have received today. So this is a clear indication that the issues that we received in KZN are not isolated issues. There's a high possibility that these are the issues that are affecting each and every person with disability across the country. And we are going to be using this portfolio to ensure that we will look into them. And Chair, on the last presentation, I just want to welcome it and also welcome the video that was also presented to us. I think that was also very important because in our family, some of us, we do have family members with disabilities. But when you get that kind of a video, it makes you realize that there is different types of disabilities that one is not acquainted with, and you get to realize the impact of technology I think those are some of the things that we are going to have to look at. And I do believe that Honorable Adonis will be in a position to assist and to guide us in terms of how we can ensure that majority of persons with disabilities, they get access also to technology. Because when you look at that video, you realize that it is a very important tool that can actually make life possible for them. And Chairperson, I think as you have alluded when you're speaking about the issue of the Parliament's website, I think that is an issue that we're going to have to look into and also check if this is an isolated case for only persons with disabilities, or the Parliament and the government website, they are actually not accessible to everyone. Because if that is the case, we're going to have to find ways to ensure that they are accessible, and they are not only 10% accessible, but that actually the number actually grows. I think that is all from my side, Chairperson, and thank you very much.
Thank you so much, Honorable Kanile, for your inputs. Dr. Leklape.
Thank you, Chair. And thank you for the presentations. Just a few questions. My first question relates to the first presentation, where a statement was made about the Department of Health having a role to play on the well-being of youth. How would that work out? What would be the role? So that we are more specific about if there are any specific things that the department can do, so we can hold them accountable. The second question is about, youth unemployment, the issue of matric output. Does our education system lead to employability? And if not, what can we do to change that? Having grown up all my life in South Africa, there were exit points for employability throughout the education system. We used to have what was called Standard 6, and those that were not academically inclined or wanted to get into trades would go into trades. You then had JC, and people could move out to other occupations, teaching, and then you'd have matric, people then proceed to university. But all of it was about employability. You now have people that come out of matric, and some of them are not employable. How do we create jobs for people that are not employable? When you contrast what happens in the youth environment, there's lots of job opportunities, scooter drivers, very few South Africans are in that. E-hailing, very few South African youth move in there. Domestic work, gardeners, very few South Africans are found in that space, even in our own homes. So how do we deal with that issue of employability? Work ethos about appreciating work. So for me, just for the first presentation, those would be the main questions. And a question that is cross-cutting is, along all the issues, our constitutional rights would be based on available resources. And available resources looks like it means state budget. Then the privileged get out of there and things are available in private. But the collective basket for all South Africans, the resources are not sufficient. So how do we deal with these rights when they are constrained to available resources? I mean, we had a famous case in health of Subramani, was a patient that had renal failure, had a medical aid, was done by the medical aid, came into the private sector and wanted to access care that was not made available, went to court, and the government got away with they have to provide what is available within the resources that they have. And that becomes a limitation of what is deemed as constitutional rights. And that goes back to the issues of investment in technology for all people of South Africa, and in particular for people with disabilities. And it was interesting to listen to the last presentation that you came from an environment of Dubai where technology was generally available, came here into a private environment, but even a private environment could not meet your needs. So because there's a lawyer on the space and you all have experience, how do we deal with this conundrum of available resources? What does that mean? Does it mean segmentation? If you can afford, segment yourself to the private sector or to the private world. If you can't, tough luck, you stay within the public sector. What does available resources mean? Section 27 talks about available resources, education for all within available resources. What does it practically mean for South Africans? How can we ensure that it is not the new way of creating divisions and those who have challenges don't get access? Thank you, Chair.
Thank you, Doc, for your inputs and questions. Over to you, Honorable Shamango.
Thank you, Chairperson, and good morning to yourself. Good morning to honorable members and the presenters that are here and everybody in the platform. I'm not going to share the screen. And thank you for this presentation, which were extensive and talking to some of the things that we have seen and we know. Chair, I am not going to separate the presentation. It actually just comments, and when you look into these inclusive schools, I visited some of these inclusive schools around January. One would agree that it was a good idea, but the implementation is a challenge because of lack of resources, even human resources that is capable to teach these the children that are with disabilities. The only thing that I've noticed that the ones that are progressing well, they started from grade R in the same school because it's from grade R to high school. The challenge that the presenter also mentioned, which I've seen there, is that there are children with disabilities that are over age, and they are mixed with these young ones because when they were rejected, then the department forced the school to take them, but they were over age, and the policy doesn't allow them to take these children. But I mean, a 17-year-old that have never seen the school ground, starting at that age, it becomes a challenge. So there's a lot that needs to be done with the implementation on this inclusive school. It's a good idea, but we still have challenges that when we do our oversight, we need to address. And recently, I visited the areas where the people with disabilities, they get together to try and do something. But to my disappointment, they try to do something. There is nothing. They go there, they sit, they talk. There's nothing to do because there is no support. And I found some of them I had to ask, what is the disability? Because you find that the one side of the board, one hand is disabled, and they've got diplomas, and one child is having an honors. I don't know, she mentioned that she's studying, so she's blind. She's having an honors, and now she was doing some modules with Pretoria for her master's degree. She's in her early 20s, unemployed. So this unemployment rate of 98.8%, I hear what Dr. Lehlape is saying. Honorable Dr. Lehlape is saying that are they employable? Some they are employable, but the opportunities, they are not there. Having said that, Honorable Chair, I also think that maybe when we think of, we look into the employment of these people with disabilities. Yes, government is on the larger scale. We're looking at the government sectors, but I think private sectors, they get away with murder because they are also in their policies. They are supposed to have a certain percentage of people with disabilities. I've worked in the private sector for more than 20 years. Every time when there will be an inspection, we'll be looking into that figure that we are not. It's like the transformation that will be looking at the senior people that there is transformation, there are black people that are there. We will be looking at that figure of disabled people that in this one we will fail because we do not. But after that, when you push for, then we have to look into that area to fit the people with disabilities. There is not that they are not there, they apply. But I don't think that they are given enough chance to work there. I remember at one stage, a guy that was on a wheelchair was employed. But the building at that private sector, the structure was not conducive for this guy that is on a wheelchair. So other employees had to help him out of his car, push him through the doors into his desk. And even when this guy was employed, nothing was done to actually accommodate him. So the people with disabilities, they are not given fair chances. They are not attended to as they are supposed to be attended to. The other thing that I've learned as I was doing the oversight in my constituency, believe me, Chair, with my limping leg, I get to the car and I'm taken to these centers. I went there, I think last week, Monday. The challenge with transport, when we talk of their rights, they struggle. They can't get to the public transport. Because once you come with your wheelchair, then the taxi driver will say, no, blah, blah. They come with excuses. So there were a lot of challenges that I've picked up, and I realized that as this portfolio committee, we have a lot to do. And besides that, it's one thing that I've done. I've assembled a team in my constituency to say, even if when I'm not here, if they can go do some, like but what is it? The profiling the community. Because what we pick up is that some of these children with disabilities, they're at home. Because in the rural areas, parents, they still believe that if a child is disabled, they are not supposed to be mixed with the people out there. They're not supposed to be in the public. Simple things like epilepsy. Children that are at home, they're not at school. So what I did, I assembled 3 members from the CMC to say, even when we do not have programs, but Biki, they must visit and try to profile the community and get those children, give education so that they can access the school. We are fortunately in Mpumalanga, especially this area of Lowveld, there is an inclusive school, the one that starts from grade R to high school. The reason they don't have a good pass rate in matric is because they don't have their own that they started in grade 1 to matric. When I was there, they said that theirs that started in grade 1, they are in grade 10. So we have that inclusive school. But if you go to the high school, it's full of children from KZN, from Gauteng, from Bloemfontein, but we have children that are sitting at home, not at school. So as a portfolio committee, I think we have a lot of work to do to assist the communities to access the schools. But otherwise, Chairperson, I really appreciate this presentation. Some of the things is eye-opener, and some of the things is what we know, and it's something that we have to work on. But honestly speaking, I want to emphasize that on our oversights, we must also check this in the private sectors, private companies, because it's not that disabled people, they can't do anything. They can, they are able, there's a lot that they can do. It pained me when I saw this child with honors, and she's now in her early 20s and she's doing masters because she got a bursary, but she's not employed. She's blind. She can work on a cell phone. She can cook. She can walk around in her house. You know, people that are blind, they know that you get used to how you do things around your space. So yeah, thanks, Chairperson, and thank you so much for the presenters. This was really good. Thanks.
Thank you, Honourable Shabango, and we agree with you that this portfolio committee has got a lot of work to do. But I also heard you, Bicky goes a long way. Honourable Mabel, it's now your opportunity. Thereafter, it's Honourable Pulwani, followed by Honourable Megan Chauke Adonis. Over to you, Ma.
Thank you very much, Honourable Chair. I welcome all the presentations that were presented to us, but I have some questions and comments on technology and disability rights. Chair, despite the 2016 white paper requiring accessible ICT in all government services, only 3 of 45 national departments publish WCAG compliance websites. What enforcement mechanism has been activated since 2016, and why has Treasury continued to continue approving ICT tenders that ignore accessibility standards? Department of Communications and Digital Technologies underspent its disability ICT program by 42% in 2023-24. How does Treasury justify rolling over unspent funds while assistive device backlogs at public school exceed 18,000 learners? And what interdepartmental structure exists to align PEPUDA, the Electronic Communication Act, and the new African Disability Protocol, so that AI-driven captioning and SASL interpretation become compulsory on all public broadcasters? Why do national procurement regulations still treat accessibility features as optional variation, thus inflating cost and discouraging uptake, instead of making them baseline requirement in every ICT tender? With AI system processing biometric and language data of deaf and blind person, when will POPIA regulations include disability-specific safeguard, and what penalties will apply to vendors that violate data minimization principles? SASL was recognized as an official language in July 2023. Why has Parliament not amended the Broadcasting Act or CAPS curriculum to mandate SASL interpretation on all parliamentary feeds and televised state addresses. What timeline has the SAPS been given the published compulsory XR accessibility standards, and how will non-compliant headset imports be restricted to prevent digital segregation in emerging virtual learning programs? When will the department table a consolidated annual state of accessible technology report with measurable indicators such as the percentage of government procured devices meeting accessibility specs to enable Parliament to track progress year on year? How many persons with disabilities sit on the AI institution of South Africa's ethics committees, and will government commit to a statutory quota to prevent able-bodied dominance in AI policy making?
Thank you.
Lastly, Chair, what fiscal incentives, tax credits, or preferential procurement points does the AI action plan propose to reward private firms that achieve full accessibility compliance? And why were these absent from the 2024 budget review? I submit.
Thank you so much, Honourable Member. Honourable Pulwane.
Yes, and our presenters, honorable members. Chair, firstly, let me welcome all the three presentations, and I think all the presentations are detailed. Chair, I've got only few questions here. Already my colleagues covered me of some of the questions. On the second presentation, the presenter mentioned that on the presentation, she mentioned that there is a lack of services, infrastructure, resources, or even the food, and the children are sleeping on the concrete. So, Chair, I just want to check if the school are on operation as we are speaking now, as he presented. And then the next question is the school is complying according to the law. And maybe the last one on this one, is there any action taken on that situation? On the other presentation, Chair, the one of technology and disability, technology makes things possible for the disability. I think I agree with you, ma'am. But my question is, what resources are needed for this technology to be full rollout? And then the next one, are there any infrastructure challenge on the school? Or the last one is, what risk to they come with or on the school? I think is the only question that I have, ma'am. Thanks very much.
Thank you, Honourable Pulwane. Over to you, Aweb. It's now your opportunity. Honourable Chauke Aduanes.
Thank you very much, Chairperson, for the opportunity, and greetings to honorable members and also to the members who have presented to us. And I would like to start by appreciating the presentations, all three presentations that have been made to us. I am Tsegofatso Megan Chauke Adonis, disabled member of this portfolio committee and an honored member of the National Assembly. Chairperson, I think just in echoing the sentiments that have been shared by my colleagues and yourself as the chairperson, in terms of lamenting the importance of inclusion and promoting diversity, but also how do we ensure that we are advancing and accelerating economic and social transformation and integration for all South African citizens. And I think this has been clearly outlined and stated in terms of the challenges, the milestones, and where we are still lacking as a country in achieving social cohesion, economic and social justice and equality, and also alluded to by some of the questions and inputs and reflections that are made by the honorable members. Just on the first presentation that was made that spoke to youth unemployment, I think that is quite critical and quite an instrumental part of what we are doing as a portfolio committee to ensure that we're able to contribute towards legislation and policy framework that seek to emancipate, or not even emancipate, alleviate the high rates of unemployment, especially amongst young people, persons with disabilities, which are the youth, and also those from previously disadvantaged backgrounds, and also taking a responsibility to say we have an accountability oversight responsibility over NYDA as being one of the fundamental instruments. Having an appreciation, Chairperson, that the NYDA will not on its own have the ability and capacity to eradicate and to really address high unemployment rates of the young people, but it would require for all government departments, stakeholders, and entities, and including quite critically the private sector, to play a pivotal role in ensuring that we are addressing the high unemployment rate amongst the young people, especially those in our rural and township communities. But additionally, on the unemployment, Chairperson, and this speaks back to the higher training department, DBE, and also to, I would say, to the science and innovation department, and also to basic, to say what is it that that can be implemented as part of an intervention strategy for us to ensure that the young people are able to acquire soft skills and skills that are contextually relevant to the current political, socio-economic climate of this country and the continent, but also providing them with the necessary skills in order for them to become employable. Additionally, for them to also take their skills outside of the continent where skills of that nature might be quite scarce. So it's quite important for us to ensure that we are following up on what legislations can be put in place, but also regulating how the private sector employs and creates opportunities for young people, especially when we speak about township and rural economic development and transformation. What is the role of the private sector in ensuring that we are alleviating poverty, unemployment, inequality amongst the young people across the country? And being able to measure their contribution and the effectiveness not only of the private sector, but of government, and also of legislations that we pass. Chairperson, as a person with a disability and as a disability rights activist and one who is deeply rooted in speaking of how do we really transform the view and output of persons with disabilities having the ability to contribute towards society, and obviously eradicating any form of systematic barriers that persist not only in our justice system, educational system, infrastructural wise, and other access and inclusion. Inclusion elements. This speaks towards our constitutional and moral obligation, not only as members of this portfolio committee, not only as members of the National Assembly, not only as citizens, but as human, as part of Ubuntu, it is our moral and constitutional obligation to ensure that our policies and our legislations must be inclusive. They must really speak directly and intentionally towards emancipating, and it must be intentionally towards emancipating and empowering the most vulnerable. Chairperson, it has been alluded that and brought to our attention, and many might know, that persons with disabilities are the world's largest minority. But yet we've got our government institutions, departments, entities, agencies, and partners, along with the private sector, who are unable to meet basic Equity Act requirements. It's not that persons with disabilities do not exist and do not have the necessary qualifications and skills, but it speaks towards a fragmented system of enabling and creating accessible and open equal opportunities for persons with disabilities. It cannot be, Chairperson, that we've got a presentation which is very insightful for many South Africans, that seeks to show us how technology plays a pivotal role in creating independence for persons with disabilities in order for them to thrive, to have independence, to contribute towards their communities, towards the economy and the development of the country. But yet you've got assistive devices that are inaccessible, that are not affordable, because they are not locally produced and manufactured. And Chairperson, this speaks towards this portfolio committee to say, which department and portfolio committee do we need to sit with, whether it is communications and digital technology, trade and industry, small business, for us to really understand what intervention put in place for us to ensure that we are creating an environment and removing red tape that debilitates innovators, create from innovating solutions and technology that is not only enabling, but is powerful and affordable, that will be designed and locally produced to meet the need and the demand of persons with disabilities in the country and in the continent. As a person who relies heavily on technology, and technology has provided me my independence, has provided me a sense of security, and has given me an opportunity to further my academic studies. It is equally important to realize that many persons with disabilities and children are left out of the educational system. And this speaks towards how do we ensure that the policy, such as the policy on inclusive education, has more teeth to it in terms of its bite. We know that when we engage with various institutions and private institutions of higher learning, we are told that it is a policy, it is not enforceable, and therefore they do not have adequate resources in order for them to accommodate and integrate persons with disabilities into their academic institutions. Now, these policies need to be more than just policies that provide guidance to the public and the private sector, but they must be legislations that are enforceable, giving this department and other relevant department better oversight to ensure that we are implementing progressive policies that really drive a true transformation and have a meaningful impact. Chairperson, we have seen, and I think this is one of the responsibility of this portfolio committee, to really accelerate the bill on the rights. Sorry, the bill on the rights of persons with disabilities. We know that the UNCRPD was domesticated into a white paper, but this needs to be further accelerated in order for us to ensure that there is more accountability, that there is more tangible legislation and laws that regulate, but also provide opportunities for persons with disabilities, that create opportunities and really speak towards the development and empowerment of the most vulnerable, and ensuring that no child is left outside of whether it is the creative, educational, economic, and social opportunities. Millions of children across the country are sitting at home. Chairperson, I reflect on a story. There is a young girl. She is 12 and blind. She has never gone to school. She suffers from epilepsy. Her mother fears sending her to a school in a different province. This child when left with community members and neighbors, is sexually abused. She is unable to identify sexual abuse. She's unable to report. Community members who are aware do not report these cases. This child is broken and thinks this is normal, but hurts inside. Chairperson, this is a dream, this is a future that is stolen from millions of disabled children. Millions of men and women with disabilities. It is not because we do not have policies and laws to protect persons with disabilities. It is attitudinal barriers that do not allow for us to really take a cognizant responsibility in protecting the lives of persons with disabilities. And this becomes the responsibility of the National Assembly, this portfolio committee, to say how do we ensure that we've got better relationships with the justice system and the justice cluster, with education cluster, with Treasury providing the necessary budget allocation and oversight given, responsibility given to this department to ensure that departments are meeting their required KPIs. Chairperson, I additionally, before I wrap up, to say that this particular Department of Women, Youth and Persons with Disabilities, many South Africans are not aware of this, is one of the most under-resourced and underfunded departments. This is a department that must service, in terms of oversight and administratively, women, youth, and persons with disabilities. These are large sectors that have cross-intersectional issues for us to address. The Department of Women, Youth, and Persons with Disabilities has a budget that sets them up for failure, debilitating them from having an adequate support to do and implement oversight responsibility. So it is important, Chairperson, that we must have Treasury come and speak to this. We must have all departments speaking and presenting on what they are doing with their budget allocations for youth and for persons with disabilities. We must be able to have a measuring matrix in order for us to see the successful implementation of the programs that they are being funded for. We must also hold the private sector accountable. We must ensure that policies and legislations have more teeth and we are able to have better oversight. We must ensure that this portfolio committee is aggressive in its oversight, in ensuring that there's further action that is taken upon those who fail to meet the requirements that have been set and become continuous perpetrators of exclusion, discrimination. Chairperson, as I close, Chairperson, I think I just wanted to highlight that as part of the presentation, I would like to further highlight the importance of us providing the necessary support. And perhaps this needs to be enshrined in our legislations as well, to ensure that we're providing support to parents of children with special needs, which are often the most neglected, and really appreciating what has been brought before us. And we do hope that these stats that are presented in the next presentation that will be made to us will be reflecting different numbers and would be showing significant development and progress, economic justice for all persons with disabilities and the youth, and also ensuring that even our policies, equity, procurement, and others are going to ensure that they are inclusive and are enforceable. Thank you very much, Chairperson.
Thank you so much, Honorable Chauke Adonis. Okay. I'm going to give the presenters 5 minutes each. I understand you are not Treasury. I understand you are not our department. I understand you're not Parliament and you're not government. So there are certain comments that the honourable members made, which of course we will direct to the relevant stakeholders or the relevant entities. But for now, maybe if I can just hand back over to the presenters for responses. I'll give you 5 minutes each. We'll start with the Prof. We'll go over to the Centre for Child Law and end off with Ms. Williamson before we go to the next 3 presentations. So in that order, please.
Before.
Yes, Honourable Polwane.
Yes. I want to apologize. I'm going to be in the bus for now. I'm not sure whether I will be able to participate. I'm going to attend another meeting.
Okay, Honourable Polwane.
But I will log in. I'll log in.
Thank you. Prof, over to you, just for the responses or your insights, reflections on some of the issues that were raised with you, please.
Sure, thank you so much. I'll try and reflect on most of the questions that were directed towards my presentation and then some of the other points made. I mean, it really is all interconnected, right? The one does not cause a problem on its own. I think that is really crucial to keep in mind. There was a point by one of the speakers about the fact that the NYDA should provide access also in rural areas and should respond to every young person. I think, and then there was another speaker who said, okay, but the NYDA cannot do this on their own. And I think that those are both very valid points, right? The National Youth Development Agency has a particular mandate, but the problem of youth unemployment, which is at the end of the pipeline of providing skills training and support and all of that, really cannot be solved by one department on its own. I think that really is quite crucial. And so the concerted effort of bringing different departments together is really important to understand. I think what is crucial there is that oversight aspect and an understanding of what resources are going in through which channels and with what outcome. I do believe that there are absolute, what we have come to think about as service deserts. There are many areas across the country, and the Explorer platform can help understand that, where the need is very high and access to services is incredibly limited for all young people, and for young people with disabilities, but really for all young people across the board. And I think that is a huge letdown of young people. We need to ensure that services are easily accessible, that they offer high quality services, and that they do not turn young people away. So that relates to the point of responding to every young person. There are various examples across the world that show that a proactive outreach to young people is important, because they have become so discouraged, but they also don't always have understanding and knowledge of what services are available where. So actively reaching out to young people is important, and ensuring that any service point where a young person can walk through the door acts as almost like a support and a referral point is really crucial. So if a young person walks through the door of the National Youth Development Agency or the Department of Employment and Labor, and the services at that point are not able to support the young person, it cannot be a matter of just closing the door and saying, we cannot help you. It has to be a matter of saying, we cannot help you, but there are all these other services available within the community or a little bit further away, and they should be able to help you with this. So building the bridges and building the scaffolding underneath that youth face is incredibly important, so that we don't continue to see young people falling through the cracks of the service provision system. There are enough resources going in across the different departments to make it possible that no young person needs to be turned away when they knock on the door of a service provider. And I think that is really crucial. There was the point also about the skills provision and whether we are skilling young people for the job environment. And I think that is an absolutely crucial question, and it starts in the Department of Basic Education's mandate. Are we teaching young people to read? Are we providing basic skills is one. Are we creating an environment that is conducive and supportive of learning? And we know that in very many schools that is not the case. How do we solve for that, and how do we hold the department accountable is absolutely crucial. The connection then to the post-school education and training piece of the system is crucial too. We heard the colleague speak about technical and vocational training and a university stream. In theory, the system exists. in practice, for many young people, it remains impossible to understand and gain access to the pieces that are relevant for them. And in many cases, the quality of education and training offered is not sufficient to provide a step up towards the labor market. So again, revision of what is being offered and accountability is absolutely crucial. We do continue to see that for young people with some level of tertiary education, so some level of post-school education and training, the access to the job market remains easier. So there is definitely a continuation of the system. We know that things as graduate unemployment are growing, but unemployment among graduates is the lowest across the board. So there is definite value in post-school education and training, but it has to be well-targeted and aligned with the needs of the private sector. And again, there are pieces of information missing where we don't actually know whether the TVET colleges, for instance, are offering the kinds of skills training that is required by the private sector and the economy in that particular environment. I think what is important, though, and we really need to all accept this, is that there are not enough job opportunities for young people available. I know that there are some opportunities. We heard the example of the e-hailing, but even there is a saturation of the market. There are not enough opportunities available. And often when opportunities are available, they are low income, precarious, no contract, no safety net type of jobs that really aren't even able to lift people out of poverty. So that really is a reality we have to grapple with, is there are not enough job opportunities available, and we can expect young people to create their own opportunities, to start their own businesses, but even there, and that is where the NYDA does have a role to play, additional comprehensive support is needed. We cannot expect young people who have come through the skilling system without the necessary levels of skill to simply go and run their own business. For many of us, that's a difficult undertaking. It will be even more complicated for young people growing up in resource-poor environments. So we really have to think about how we offer the kind of longer-term comprehensive support that then helps these young people make a success of a business endeavor, rather than seeing them become even more precarious because they invest and they make debts and then the business doesn't succeed. And then what? So in all of this, there are two pieces to the coin, right? There is what we offer, and there is what a young person is able and willing to take up. I think I will leave it at that. Oh, there was a question around, for instance, connecting the dots with the health department. So it goes back in part to my point of there should not be any closed doors for young people, right? When a young person walks through the door, because they are feeling severely discouraged, and many of them struggling with high levels of emotional ill health, there is very little support available for young people in terms of mental health in our communities. It is a stigma. It isn't something that young people can easily find support for. But if we are not well, if we are not feeling like we are able to progress with our lives, we all need a moment to find support. It doesn't really exist for young people to the extent that they would be willing and able to take it up. Let me leave it at that. Thank you.
Thank you so much, Prof. And we really do appreciate your time and your participation this morning. Over to you, Ms. Karabo.
Thank you so much, Chairperson. I think I picked up the 4 or 5 questions or issues that I'll respond to quickly. On the first question about the judgment of the Western Cape Federation for Intellectual Disability, the 2010 order did not provide timelines for compliance, and that's one of the reasons why now there is a question about whether between then and now enough has been done for children with intellectual disabilities. And instead of us just rushing back to court, we decided to do research to track what's happened between 2010 and now. And then out of that, we will plan for advocacy, litigation, and other ways of engaging. So that's that. Then there was an issue about the Ikwezi Lokusa, that's the school, the Eastern Cape school that was in the media, and children were sleeping on concrete. So the update on that case is that the school was closed, but then money was made available for upgrading the school. And I did a quick search now for the current update on that, and it looks like there's delays with the upgrades. There's issues about what has happened in relation to the contractors and the money that was allocated for the school. I know the Human Rights Commission in the Eastern Cape is monitoring, but it may be something that the committee could consider taking up, because there was quite a lot of attention even on carte blanche, and also now in if the school issues led to there being funds being made available to rectify the situation, but that is not happening. That is something that also needs to be interrogated for accountability, because currently then it looks like learners had to be placed at other schools, even as far as 200 kilometers away from that place that's closer to their homes. So that is something that is really concerning. There was an issue that kind of came up in relation to the Constitution and this approach of available resources. And I mean, a lot can be said about that and, this progressive realization. But one of the things that is very important when we're thinking about, well, government and providing, and the fact that there's sometimes a need for longer term to realize socioeconomic rights, is that we need to really start engaging with the fact that so many of the departments and even Department of Education sends money back to Treasury, whereas the outcomes for children on the ground are what we engage on. How do we send money back that was allocated for education, for improving infrastructure for school children, and we still say, oh, we couldn't, we don't have, we need 10 years. And we know, for instance, even just generally in relation to school infrastructure for all schools, not focusing on just children with disabilities, that there was a timeline for eradicating improper infrastructure, which then was removed. The 10-year timeline was then removed to make it open-ended. So what does that mean? It means that we're now giving us longer time to do what? To violate children's rights, because we're sending back money to Treasury and we're not really living up to what we're supposed to do. So that is something that needs to be interrogated. And then there was the issue of, one of the members mentioned the issue of children not being in schools in our communities. And I think this links with what Ariana said, that we must also remind people that children with disability or persons with disabilities, the responsibilities towards them cuts across a lot of departments. And one of the key departments in taking care of children is Department of Social Development. There are issues in relation to prevention and early intervention services for children in our communities generally. But you can imagine for children with disabilities, it might even be heightened if they're being kept at home, kept indoors because parents don't know where to take them. What are we doing there? Is somebody going into communities and engaging with the parents who are struggling with these issues pertaining to their children with disabilities? One of the other things that we've picked up that is of concern to us is also when children with disabilities, their parents apply for care dependency grants, and the challenges when assessments are being done. At SASA appoints a panel of medical practitioners to do the assessments and all those. There's been an issue about how that assessment most of the time doesn't accord with the assessment that maybe the parents have done at a different facility, and that actually leads to then the exclusion of children from getting that care dependency grant. That is another issue that I think from a social development perspective needs to be engaged with, and also there is a role to play for Department of Health. There is an issue about the forms and the regulations and how you do the assessment for for a child to then be able to get a care dependency grant. And then there was that issue about the concern of mixing smaller children and older children who have been out of school for some time, but now because there's pressure to just put them into schools. That is an issue for concern, and I think it's another issue where there needs to be engagement about, yes, we are wanting the 17-year-old, 16-year-old to catch up and to skill them, but how do we do that in a way that we still, differentiate between the groups and actually provide safety measures? Because also there are challenges once you start mixing quite older children with very small children, particularly where children are vulnerable because of disabilities. So I think those were the few things that I picked up. I hope I didn't leave anything out. And thank you again for the opportunity, Chairperson.
Thank you so much, Ms. Karabo. We really appreciate it. Please, can I ask Chelsea just to address some of the issues that were raised with you?
Thank you, Honourable Chair. Just to start, honourable members, I'd just like to point out person first language. A couple of you were using outdated language, and I think it's really, really important as we're moving forward that we're using the correct language that's not othering persons with disabilities. So I'm just going to pick out a couple of language just to correct, and then I'll respond to some of the points. So the first one was impaired or impairment. And that's very outdated language. And to give it to you in context, I'm a woman, we live in a patriarchal society. So rather than calling me a woman, calling me gender impaired, you're pointing out my lack rather than who I am. So let us not use the language impaired, but let us use the person first language, which is recommended by the UN CRPD committee, which is person with a disability or person with a physical disability and so forth. The second one is special needs. These are not special needs. Children and adults with disabilities do not have special needs. They have reasonable accommodation and they have accessibility rights, which are human rights. They are not special needs. When we say special needs, we are pointing and othering them and isolating them further because they have needs that are special. So let us use the correct terminology. And lastly, able-bodied. Again, we are saying we are able-bodied. We are persons without disabilities. Just keeping that in mind going forward, honourable members. Now to some of your points. Karabo has just mentioned some of them with Honourable Lelape and Honourable Polwane. You mentioned available resources. Karabo has mentioned how we are sending money back to Treasury, and this is something that desperately needs to change. There are resources available for children with disabilities. And we are, like I've mentioned, in the fourth industrial revolution, and digital literacy is so important. If we want children with disabilities to be able to gain meaningful employment, they need to have digital literacy skills. Even today's meeting, we are holding on a digital platform. We are all in different provinces and different areas. And if children with disabilities do not have access to digital literacy skills, they will not be able to participate in the fourth industrial revolution. There are very few jobs available in today's day and age that do not require access to some form of technology, whether it's basic typing skills or being able to do digital meetings. So there are resources available. We just need to allocate them correctly. And then moving forward to Honourable Shabangu, you mentioned implementation challenges. I fully agree with you. And you also mentioned the age-out problem. Again, I want to reinforce what I said. 70% of children with disabilities are not accepted into schools in the first place, and this is the first challenge we need to overcome. One child that I was working with was autistic. She had a physical disability and she was low vision. She went to schools for children with autism, was rejected because of her other disabilities. She went to schools for children with physical disabilities, was rejected because of her other disabilities. Went to mainstream schools and was rejected because of all of her disabilities. And because we are still living in a segregated education system for children with disabilities, children like this girl are excluded from the education system as a whole. We need to move forward to an inclusive education system, a full service inclusive education system. And this needs to be our first challenge, because 70% of children with disabilities have no access to education because they are being discriminated against because of their disabilities. You also mentioned the blind person who's not employed. And this for me ties into what Honourable Megan said about attitudinal barriers. We need to overcome this barrier of attitudinal barriers because there's so many stigmas and bias against persons with disabilities, even if they are qualified and even if they do have the necessary education. And in fact, this is outlined in the CRPD against discrimination. And we need to really, really look at our legislation and see where it's discriminating against persons with disabilities. And I want to challenge some of the honourable members today, having a look and working in this space. I see how BBBE is really impacting the lives of persons with disabilities, because currently there's 2% of persons with disabilities that's on the scorecard. It's just been increased to 3%. However, this only caters for Black persons with disabilities. If you are Indian, coloured, Asian, or a white person with a disability, you do not contribute towards the BBBE scorecard, and therefore most companies will not employ you because there is zero benefits. They will not get a BBBE scorecard. It doesn't count towards, some of them do count towards the employment equity, But because of the attitudinal barriers and the reasonable accommodations that are needed, they ultimately do not employ these persons with disabilities, and therefore this unemployment cycle continues. We are also seeing the Black people with disabilities that are employed are not being provided with reasonable accommodations. And this again calls for the domestication of the UNCRPD, because reasonable accommodations need to be provided to persons with disabilities that are employed. And it becomes a tick box exercise of saying, yes, we've employed our quota of how many Black persons with disabilities we need in our space, but they are not provided with accessibility or reasonable accommodations, and therefore are not able to do their jobs, and therefore are not included into the workspace and the work culture. They are not able to make friends, they are not able to socialize, and they're not able to do their job effectively. And ultimately, the cycle of discrimination continues. You also mentioned accessible work environments. There are policies in place that say that environments and buildings need to be accessible to persons with disabilities, but once again, it comes down to the lack of implementation here. Honourable Chair, I see your camera on. I'm wrapping up, I promise. The last point that I wanted to bring up was South African Sign Language interpreting was raised by Honourable Mabel. We need to have South African Sign Language interpreting that is regulated, because we are having so many cases of South African Sign Language interpreters that are underqualified, that know basic sign language, but are being employed in different areas, and therefore the deaf community does not have access. So these are just some of the points that I managed to raise. I know that there were other ones that I haven't, but you are welcome to reach out to me. Thank you so much, Honourable Chair.
Thank you so much, Ms. Williamson, and I'm sure this is the first of many more engagements, and we do value your time, as I said before, but also do be assured that our portfolio committee will be taking up all the issues that you've raised today with us, and we do plan to focus on all of these shortcomings. But it gives me now pleasure, as we move over to focus on women's rights and gender-based violence matters. We will call on Prof. Gertrude Vester to give us a presentation. Professor Vester is an anti-apartheid activist. She's also a former member of parliament and former commissioner of the CGE. She obtained her PhD at the London School of Economics in 2007. As an activist, Prof. Vester was a founding member of many women's organizations. She also continues to lecture at many universities overseas, and back home she lectured at the Sol Plaatje University as well as University of Cape Town. Prof, thank you so much for your time, and we look forward to hearing from you and getting some of your insights and expertise.
Sorry, Chair.
Yes, yes, Doc?
Just a brief intervention to correct the fact that Black economic empowerment includes Africans, Indians, and Asians and coloreds. It's not exclusive of those groups, just to make a correction. And I'm not arguing about its possible negative impact.
Okay,
But
noted.
Let it be defined properly. Thank you, Chair.
Thank you. Prof, now is your opportunity. Thank you for your time. Please just unmute yourself.
Sorry, I forgot about that. Thank you very much for this opportunity to share my experiences as a Commissioner on Gender Equality. When I asked for the briefing, I was told that maybe some of the members do not know what the Commission is, and if I could explain that. But I asked, is it possible that I could just give a brief context of why the Commission on Gender Equality and how? And I was told it's okay. So my presentation will be in two parts. I'll give a brief, maybe 5 minutes of what the struggles were since the 1980s, and then the actual input into the Constitution and the Chapter 9 institutions, and of which the Commission on Gender Equality is one. So I do not have a PowerPoint because I'm telling a story. I'm telling her story. So firstly, I'd like to actually just say to you that I was part of the United Women's Organization in Cape Town in 1980. And the first meeting I actually went to had a tape and slide presentation of women in Mozambique. And they highlighted how the women were involved in the anti-colonial struggles and the struggles for equality. However, when the revolution came in 1974, women were then once again pushed back into the kitchen and out of the public domain. And it was a very, very important question to us as women political activists. No, we don't want that to happen in our country, and we need to explore mechanisms that will ensure that women will be a decision-making in all other levels. And that is why, of course, we even have your portfolio committee. I also want to emphasize to you, I was part of the Joint Monitoring Committee on Women, Equality of Life and Status of Women, but I must say that I understand and I agree totally with you when you say you have a mammoth task. I mean, even a task. If you have to have gender, we did what was called the intersectional approach, right? Looking at race, class, gender. We looked at people in disabilities. We looked at rural, urban, etc. But your portfolio is so challenging. I really, really wish you well with your very many challenges. And also, like the other speakers, I also am available whenever you need to have some sort of interaction. So yes, then I became the education and training portfolio in United Women's Organization. And it was every International Women's Day, we looked at the situation of women in other countries. And especially those where there were revolutions or a change in regime. We did, for example, Algeria, Cuba, Nicaragua, the Soviet Union. And what was amazing to all of us, that in all these political struggles, here were the women right on the forefront of the political struggles, and yet post-revolution, the situation's changed. I must say it was even actually quite sad in Zimbabwe. You know, they had so much equality in their army that women and men shared the barracks of ZANU-PF. And post-independence 1980, many of these women actually then had babies, and they were all labeled as prostitutes and couldn't be part of the new regime. So it was just for us such a very, very stark lesson. What are we going to do? And I want to just very briefly say to you that what we then did, and I must say that even though we were United Women's Organization, we actually was started by women from the 1950s, people like Mama Shishlangu, Dorothy Faku, Mildred Lucia, who were actually active in the 1950s, Amy Thornton, who were going on her way to the march in Pretoria, but the police stopped there, and Amy was saying the biggest problem that the police had was because she was a white woman with all the black women going to this march. So yes, it's a long struggle, and we built on their struggles. We built on their struggles. And we also, as much as we were in the Western Cape, and I really think I need to share with you what I found phenomenal. I was away in the Netherlands doing my master's, and when I came back here, I joined the United Women's Organization, and there were 6,000 members. And you must remember, it was in the middle of apartheid, and yet we had branches from Gardens to Gugulethu, from Macassar to Muizenberg, from Athlone to other areas as well, Claremont. So it was a really phenomenal movement of women. And the fact that we've been able to do that was, I must say, pay homage to the women who went before us, and they set up these interracial connections. So and then we had contacts with women in all other parts of the country. They even in small areas like Prince Alfred, there were women's organizations. Port Elizabeth now was Natal Organization of Women, where Preg's government comes from. And then there was the FETRO, the Federation of Transvaal Women, etc. And we all worked together. And then it was decided maybe we should relaunch the Federation of South African Women. Now, for those of you who may not remember, the Federation of South African Women was formed in 1954, and it was started by the ANC Women's League, the Coloured People's Congress, the South African Indian Congress, and the Congress of Democrats. And those were the different groups of people all coming together, and they actually had the first Women's Charter in 1954. So we decided, oh, maybe we must raise this again, you know, and form this one national organization. The Western Cape did it, but the others didn't. There's no. We need a wider and broader Alliance of Women. So then the Women's Alliance was formed in 1991. And the reason why the alliance was formed was because the ANC was just unbanned, and the SICP and the PAC. And there was the first meeting with the National Party, the government then, and the ANC. And there were all these men and only 2 women, Cheryl Carolus and Comrade Ruth Mampati. And we thought, oh no, we've got to broaden this line. So for the first time, we as grassroots women in the non-racial struggle worked with women in parliament. That was then called the Democratic Party. However, we felt that it wasn't strong enough. So we decided to form the Women's National Coalition, and that was formed in 1992. And when I say we, it's because I was part and parcel of these struggles. And so it's difficult to say, oh, the Women's National Coalition did that. I must say, it was such a big challenge. There we were, women from all different backgrounds, all different parties. And at that same time, there was in the KZN, maybe the people from the ANC and IFP busy fighting, and they called it the killing fields. And here we are as women. In fact, the KZN women said, here we are, women singing and dancing together while our men are killing each other. So it was a big challenge, but also what was a challenge was we then decided we needed to find and hear what women want in this new constitution. And then we decided we're going to have another women's charter. So what we did is we went to churches, to unions, even to shopping malls, saying, what do you want in this new constitution of ours? Because remember, we also had representation at the negotiations. And we then drew up the Women's Charter. So I need to say and emphasize that it was actually a very difficult challenge initially to get women's and human rights issues on the agenda for the Constitution. But it was a very, very hard task and challenging, and what was actually good. In fact, I think some of the National Party women actually wrote an article which was an agenda, and they said it was so interesting seeing how the men also suddenly changed their language to be more inclusive. So yes, we have now, as you know, the Chapter 9 institutions, and of which the Commission on Gender Equality is one. What I must also say to you, and I have all the background in the paper that I've sent, that actually shows how we moved from gender mainstreaming, where we decided we're not going to have a women's ministry, we're going to have gender focal points in each department, and we would then do the monitoring. But we found that firstly, when we went to the different departments, they didn't even have the gender focal points, or a woman who was involved in law and litigation, because she had a passion for gender, she was the gender focal point. So it didn't always function very, very critically. And I also have to say that 2 commissions, Commissioner Mainkes from WITS, former WITS, and we were doing monitoring. We'd monitor, go to different parties, different political formations to see what was happening. I was privileged, I don't know if people know the Radio Sonder Grense, which is an Afrikaans station, but which was very prominent in the rural area. They gave me a slot every Friday, and it was quite interesting when I went to plain dorpies like Vredendal or Bethesda. There people say, oh, ek ken daai stem, I know that voice, and they actually, so the radio was very helpful in spreading it. But now what actually was of concern is that I'd go to, for example, a rural or even just Malmesbury local government to monitor, and there were only men. Then I wrote to all the provincial government in the Western Cape, because I was based in the Western Cape, and I wrote and I said, oh, I'm Chapter 9 institution, we're coming to do the monitoring, can you give us a date, etc., etc. No response. Then, after a couple of letters and phone calls, unresponses, I wrote to the Premier of the province. And I wrote to the Premier explaining what my task is and how many times I've sent invitations to come and monitor the departments, and there were no responses. And if there's no response by a certain time, I can't remember what I said, I'm going to the media. And then Premier then asked me for a meeting. And what was interesting, as I went into the Premier's office, the law advisors walked out and I saw they all had copies of the Constitution, which meant they were actually looking at what are these Chapter 9 institutions that this woman is talking about. So anyway, and then I had access to the different departments. Once again, all the departments, just men, and mostly pale males and one or two black. Then I went to education. Oh, and I was so glad there was a woman sitting in the corner. And then as the meeting proceeded, I realized, oh, she was just the note taker, the minute taker. So yes, it was a very, very important, insightful situation to see how the very government, and we decided we're going to monitor government because government are the people, they're the people that made these rules and they should stick to the Constitution. They should be an example. But also we were only 12 commissioners and 5 were part-time. So we couldn't monitor the entire country. So the mandate of the commission is actually very, very masked, but I want to come up to that. So yes, I was part of the second group of commissioners, and that is 2001 to 2006. So when we were nominated, we were confronted with a few challenges. We had our first meeting with some of the outgoing commissioners and to share experiences. The first thing we were confronted with was there was a 1 million rand lawsuit against the commission. The CEO of the commission was given notice and she was taking us to court. So here we started, very enthusiastic to promote, protect, educate, and monitor gender equality in the country. We were stuck with lawyers. Anyway, we managed to sort that out. But then the other issue that I also want to mention is that the Act, the Gender Equality Act 39 of 1996, was not in line with the Constitution, because the final Constitution of the Republic of South Africa was Act 108 of 1996, which meant that the CGE Act was written before and therefore not compliant. Also, it was then decided by a cabinet memorandum that there'd be an office on the status of women within the presidency. And what was perhaps maybe shortcoming was they did not outline the functions of the OSW. So there was sometimes, I need to be quite open and honest. There was sometimes maybe some tensions because they thought we were doing their work and we thought they were doing our work. So the legislation and the cabinet memorandum did not coincide. So it was very, very problematic. But now I want to highlight the more active charges and things we've done. I think I must also give maybe recognition to some of the good work that was done by the very, very first commission. It was the conference on witchcraft. Some of you may know that in the rural areas, and even sometimes I know in case in Kailicha, how women were accused of witchcraft. So there was the first national conference on witchcraft in South Africa. And they did sterling work in terms of research, in terms of legislation, and in terms of exposing the situation, how women, and you know what it was? Sometimes women's husbands died, which meant she had the house and maybe the small holding. And then the family came, the husband's family came and said, oh no, this woman is a witch and she bewitched our son and therefore we are claiming the farm. And there was even a place, I think it was Mpumalanga, where women actually had to flee to go and hide because they were accused of witches. So yes, there were very, very major issues happening. And as I say, I want to laud the work that they've done. I want to just say that the key thing that we did in the Western Cape and in other provinces, so we had both national tasks and provincial tasks. So my national task was to be on the monitoring committee. And as I raised earlier, Professor Sheila Maintjes from WITS and I were the two who were doing the monitoring at national level, provincial level, and local government. And I must emphasize that we did not get much cooperation from the departments until I resorted to, as I say, a letter to the Premier. Then in our provinces, we had consultative meetings. We called together many organizations that were existing, and we also invited others. We also, I must say that the role of community radios were very key in our work. We had, for example, one of the things that I had to do was the inclusion of Muslim personal law into the Constitution. And this was given to me in December, and the Law Society wanted the response by middle of January. Now, you all know South Africa, we have holiday. So I used the radio in a Voice of the Cape, which is a Muslim radio, and the other radio was 567, calling all people that are interested and maybe sheikhs and emirs and feminist lawyers, etc., to come and give input to this constitution. So yes, the radio, even though we had pamphlets, you know, I felt that the radio was very key in our work. But as I said, we had broad consultative meetings with organizations in our areas, and we also have working relationships. We ask them, what are your issues and what must we emphasize? So I'll just highlight a few and leave mostly for the question time so that there's maybe a constructive interaction if there were things that were not clear or what were our challenges. I also need to say that apart from the fact that the CGE Act 39 of 1996 was not conducive with the Constitution, every year we would tell that to the portfolio committee and we had to report to Parliament. And I must say that we made lots of submissions to Parliament, and I'm not sure whether it was just the overwhelming task, but many of our very important submissions actually were not taken notice of. And someone earlier, one of your honorable members, mentioned the fact that your budget is so small for the work. And I mean, I must say that your work is overwhelming. The same thing happened to the CGE. The CGE had a very small budget compared to the Human Rights Commission, and we raised that time and again. Also, I know that this may not be a very politically correct point, but I need to emphasize too that the commissioners on the CGE were paid at the deputy director level, whereas the commissioners for the Human Rights Commission were paid at the director level, sometimes almost double what we earned. And we've raised these issues. I also need to emphasize that we also then said to Parliament, please rectify the Act. And I noted that only in 2013 was the amendment done to the CGE Act. And I saw that it's on there's a copy also, just aligning the references with the new constitution. What work did we do? I had a film festival in the Western Cape, and the first thing we did was engage women filmmakers and schools from Langa, Khayelitsha, Athlone, and Sea Point, having these films showing young women at schools what the possibilities are in terms of issues around gender violence, etc., but also that they could become filmmakers. So it was a very double-edged sword. We also had the very first women's book festival at the waterfront, and once again we were in partnership with the waterfront. So there, what we did is we had all these meetings, breakfasts with different restaurants and women writers promoting their work. We also had a big issue on women and older women. I must say that as you portfolio is a very large one, and we too, but we did what was called intersectional. So it was race, class, youth, rural, urban, and older people. And we found that lots of older people were really abused. So we had that as part of our festival as well, highlighting that. And I had a play on called Yesterday's Princess, which I did, and discussed a panel where various key women were on the panel. We also did, the other issues were international tasks, for example, going to the African Union and working on what's called the Maputo Protocol. And what was so organized is that women in Africa, we all organized ourselves to lobby different countries. And I, for example, had to lobby Senegal and Sudan to ensure that women's rights are included in the African Charter of Human and People's Rights. And that was ratified in Maputo. Other issues were, ironically enough, to the United States Congress, the oldest democracy in the world. We were invited by the women from Congress, and their question was, we've had our democracy for 200 years, but we have so few women. What did you do? So we were there as women from South Africa explaining what we did in terms of 50-50 and 1/3 in cases, the quota system. And then also there was Rwanda, which I think most of you may know, has the most women in parliament in the world. Then we went to Ethiopia. Oh, I've mentioned Ethiopia in Maputo Congress. And I'm not quite sure how much time I have now, but I just want to highlight to you to say what were our major challenges. The major challenges as commissioners was our budget, was the fact that we really have impressive legislation. But as other people have highlighted earlier, implementation is the problem. We even had a march with then the Minister of Justice, the Deputy, Cheryl Gilwood, and our biggest banner was impressive legislation, but what about implementation? We also had differences around the Constitution and various. Now, I want to highlight another Chapter 9 institution, and that is the Commission on Culture, Religion, and Linguistic Communities. Now, of course, one doesn't undermine the work of the other constitutional positions. But what I need to emphasize is that what we were doing in the Gender Equality Commission was sometimes the opposite of what was the Commission on Religion, on Culture, Religion, and Linguistic Communities. So that was a big tension, and that may be a challenge to take on. I think also the other issue that we also want to say is that I try to emphasize the struggle that we had as women organized in the 1980s to put input into the Constitution. And yes, I think we all know that many countries, in fact, I was invited to New York Law School in 2014. They were celebrating the South African Constitution. So many countries have used, and even a small country like Fiji has used our constitution as a model. So yes, we have an impressive constitution, but I know, honorable members, that your task is one challenging one, and that how do we make these wonderful things, these wonderful theoretical things a reality. But as I say, all the best to you, because I know you have a mammoth task, and thanks very much, and I look forward to questions.
Thank you so much, Prof. And thank you for
fine.
Thank you for sharing your insights. And I think sometimes it's important for us to look back in order for us to look forward. And some of the challenges that you've just highlighted are actually the exact same challenges that we are still facing with the Commission for Gender Equality. So thank you very much, and we will be engaging with you. It now gives me great pleasure to hand over to Lisa Vetten. Lisa is no stranger to this portfolio committee. She's a gender-based violence expert. And she can also tell us a little bit more about her own work. She's from WITS. She's very busy. She's just been roped into the Mbenenge judicial conduct hearing. So thank you for making time for us, Ms. Vetten. Over to you. Lisa? I see Lisa is logged in, but I don't see.
Yes, because Lisa is on mute. Talking away to herself and realizing, no, she's actually on mute. So apologies for that.
Thank you.
I'm going to share my presentation, and then just, if people don't mind, put my alarm on, just so that I keep to time, because I'm aware there's still another speaker after me. And I don't want to deprive, I don't want to eat into their time. Okay. Just move all this other stuff out the way. Okay, can you see okay, is it sharing?
Yes, Ms. Vetten, thank you so much.
Okay, great. So what I really want to do in this presentation is pick up a little bit on your discussion last week, it was, with the Department of Women on the NSP. And just to briefly comment on some of I picked 3 pillars, scorecards, or issues just to focus on, I think, just as a way to comment and encourage us to think differently and broadly, and things we can add to the NSP in order to make it more effective. So that's how I've structured it, is around those 3 particular pillars. Pillar 3, the justice system. The Pillar 4, which is looking at services, and Pillar 5, which is looking at really women's employment and economic opportunities. So while I'm going to focus on those 3, they have very definite implications for Pillar 2 on prevention and Pillar 6 on research. So that's really what I want to focus on in this presentation. It does have quite a lot of data in it, so sorry if I'm going to kill you with lots of numbers, but I do think they tell a story that is useful. And they will also, I think, pick up on some of the points that people have already made, especially in relation to budgets. So let me just move this out the way. Okay, so what I want to begin with is Pillar 3's emphasis on the criminal justice system. It came up in some of the other pillars, but the importance of looking at statistics and data. So I want to look at the data for femicide, because I think it does present us with some very big questions about the quality of data. Because while we certainly do need data, it's also got to be good data that we can rely on, especially if we're trying to think about prevention. And also, I think, for telling us what's going on. Because I think a lot of our discussion around gender-based violence tends to be very static. We use the same explanations all the time for why it happens. We don't think about what is changing, what is different in the context, what is shifting, how might the conditions for violence be altering? And this question is incredibly important in relation, I think, to women's murders in particular, femicides. So just to illustrate this, I've given you on the left-hand side of the column police data for 2022, 2023, and 2023, 2024. And I've compared what the police's crime registrar puts out in their annual report, where they put out all statistics for the year, versus what the police's quarterly reports, because this is telling us something very troubling. So if you look at 2022, 2023, if you add up the police's statistics in the quarterly reports, they'll tell you just under 4,000 women with 3,914. But if you look at their annual report, they're telling us that actually 518 women more were murdered, that the figure was 4,169. But I think, and what I want to also draw your attention to is this figure in the brackets. Now, the police also give us figures for domestic violence in their quarterly reports on crime. And they include in their figures for domestic violence, murders of women within a domestic context. So if those statistics are correct, then it means that 518 of the 3,914 women who were murdered in 2022, 2023 were murdered within a domestic context, which might not only have been their partners, it can also be other family members. I'm going to flag that before I get to the MRC data, which I think is where we start to see some real questions being asked. But I think the last set of statistics I want to really flag is the comparison between what the crime registrar gives in the annual report for the number of femicides that happened last year versus the quarterly reports. The difference is 1,739 more. So that is alarming. If we just look at the annual reports, to have an increase of over 1,000 women's murders in 1 year tells us that something is very wrong, either with the statistics or that something happened which we have not been taking note of. Personally, I think it's the crime statistics, but the police will be the ones who need the annual report that is wrong. The police will need to explain to us how they managed to find 1,739 or almost 45% more murders when they provided their annual report than when they'd been providing their quarterly report. Again, the number of the figure in brackets, it's only for 3 quarters because they didn't make their 4th quarter report available. Again, the proportion of women they're giving as being murdered in domestic context is very small in relation to the total number of women murdered. So those are the police statistics. I'm highlighting them because it's very expensive to do research every year. And therefore, we do have to rely on what we're calling administrative data. statistics that is produced by government departments. So in the absence of research, we have to rely on administrative data to see, are our interventions working? Are they not working? What trends are shifting? What's changing? But we have to be able to rely on this data. And I'm flagging the femicide because it's telling us, certainly it's telling me, I'm not too sure what really to be trusting. Especially when you compare this to the Medical Research Council's data. Now, the Medical Research Council's data is research. It gathers information from the mortuaries. So it will go to the mortuaries and look at how many women's bodies are, it will draw a sample of mortuaries and look at how many women's bodies are in the mortuaries, and from that, then track back in trying to understand what has happened, which is different to what the police are doing. The police are getting some mortuary data, but also inquest data and other sources of information to compile their murder reports. And of course, people who are actually coming to them to report a murder. So it's important to see whether or not we're losing any numbers between what's being picked up at the mortuaries and what's being picked up at the police. So if we look at the Medical Researchers Council, what it's telling us is something very important. It's that in 2017, just under 2,000 women were murdered that year. Why I want to highlight that is because us that there was a success story in South Africa at one point. That in 2017, the number of women murdered were the lowest it had ever been since democracy and the figures had started being recorded. So that's good. It tells us we were doing something that was effective. But it's telling us something else, is that while women's murders were going down over the roughly 25 odd years, men's murders had been going up. Both men's and women's murders had decreased until about 2010-11, and then in 2011-12, men's murders started increasing. Why I want to highlight men's and women's murders is because I think it's very important to go back to this point I was making earlier about needing to understand what's going on, about needing to pay attention to broader trends. We need to ask what was changing that men's murder started increasing from 2011-12, whereas women's continued to decrease. And just to give you a sense of how different the figures were by 2017, in that you had 59.7 men per 100,000 being murdered versus 9 per 100,000 women. So something very gendered was going on that we weren't necessarily paying to. And it means I think we've missed something very important, is that something has changed since 2017. Women's murders are now on the increase. You can see in 2021, 177. As I said, these police statistics are showing quite significant increases in comparison to their MRC data. But from a preventive point of view, and the point I was making earlier about being able to track trends and changes, we need to explain what has happened post 2017 for women's murders to start looking like men's murders, to start increasing. And this is despite the context of national strategic plans, raised levels of awareness, etc., etc. So that is my first point about statistics, is we're not using them to their full strength and full capacity to ask the questions about what's going on, what's possibly increasing and what's decreasing, and why there are differences between men's and women's murders, and what that might be telling us about different patterns. And I think just the last pattern I want to highlight is that if you look at the police statistics, they suggest that the number of women being murdered in a domestic context is very low in comparison to the overall number of women murdered. That simply does not gel with the figures that the MRC is providing, where they're saying to us 60% by 2021-22, or more than half of women were murdered by their partners, and that this represented a significant increase, and this increase was most apparent in Gauteng and Eastern Cape. So again, why we need good data is to tell us why this increase and why in two provinces rather than in, more significantly in two provinces, rather than say Limpopo, where the figures are very much lower. So the next set of figures I want to look at is really, I think, just in relation to, especially because it's been in the news in relation to the Omatoto trial, is what is happening to the prosecution of rape. So what I've tried to do here, and I'm sorry, this is lots of numbers and percentages, is try to do a comparison of the number of sexual offences that are reported versus the number of matters that are set down for trial. And then I've tried to look at of the matter set down for trial, what percentage is that of sexual offences versus rape? I've given both because the NPA only gives us stats for sexual offences, which is broader than rape. But I suspect they prosecute far more rape than they do sexual offences, which is why I've also given you percentages for rape. And then I've given you the number of cases that actually result in a conviction, calculating it as a percentage of the matter set down for trial. And then the last two columns look at what percentage is that of the number of convictions as a percentage of the number of reports. So I want to draw your attention to the two numbers highlighted in yellow, where the NPA in 2013-14 was really doing its best. You can see then, okay, let's see, I'm 10 minutes already. I'll try and speed up. So you can see already in 2013-14, the NPA was putting down 8,173 matters for trial. Compare that to 2023-2024, where they're putting down 5,276 matters for trial. Now you'll see there's roughly about 3,000 fewer rapes that were reported in 2023-24 versus a decade ago. So in theory, the NPA should have fewer cases to work with, so therefore they should be putting down even more cases for trial. But that's not what's happening. So where they were putting down 14% of trials of reported sexual offences for trial in 2013-14, they were managing just under 10% last year. And you can see this similarly if you look at convictions. There were securing convictions in over 5,000 matters, which was impressive. By a decade later, they were managing 3,813. Again, if you're able, if they were able to perform at the same rate they were performing a decade ago, you would expect both more cases put down for trial and more cases resulting in convictions. And what I want to highlight is this question that I think we need to really challenge departments on. Turn indicators into targets. Because if a target becomes how your performance is judged, and parliamentarians are going to yell at you, so is your minister going to yell at you, your merit award or bonus is going to depend on whether or not you hit your target, then you are turning a target into a perverse incentive. So actually, in 2013-14, when it looks like the NPA was doing worse, only 67% of their matters were resulting in convictions. If you look at the number, they were doing better than they did a decade later when they were putting down fewer cases for trial, but achieving a higher conviction rate. But that, as I said, as I'm pointing out, is because they're putting down fewer cases for trial. So, when you're doing your oversight, I think we should be in cases of things like convictions. That's actually not something that should be used as a target because it's a performance indicator. Your indicator should really be how many cases are you putting down for trial? How many are you allowing in through the courtroom door in order to have their chance in court, their day in court in order to tell their story? And there isn't the time to go into it, but I think there is a whole set of figures we should be looking at about what percentage of those with intellectual disabilities are getting their chance at court. And the number is very small, but that'll have to be a subject for another day. I want to look very quickly at protection orders. Again, because this is data we're not getting and should be getting, the Department of Justice stopped providing figures around the number of people applying for protection orders versus the number of those who got protection orders versus those who were finalized in 2015-16. For reasons they haven't explained, this kind of data is no longer available. It's important because, as you can see, there's a filter happening here. In the last year, you might have had 275,000 applications made, but just under 2/3 were actually being given interim protection orders, and overall, only 1/3 of those were actually getting final protection orders. So this is telling us something very important about the number of cases, the number of those applying for a protection order versus the number of those who ultimately get finalized. There's a very distinct problem here that we need to look at. I'm going to just speed up a little bit in order to ensure that I finish on time to leave time for the other speaker. So just to come to now the budgets. So this is what the Department of Women, Youth, People and Disabilities presented last week as to what the department said. They were allocating towards implementing the NSP and towards gender-based violence. With the greatest of respect to departments, they can't possibly know what they are allocating because they don't cost their programs. They cannot tell you, for instance, what it costs. And this was the Public Protector's report last year, which everybody seems to have forgotten about. And as a committee, I'd really urge you to go and call the Public Protector to ask her if the department has provided the minimum standards that she asked they do for the sexual offences courts and for the domestic violence courts. Because once you have those minimum standards, you can actually cost. And then once you've costed, you can actually say, well, is the department spending enough? I mean, one of the reasons, and this is very important to know in relation to, I'll go back to protection order. What has happened in the Department of Justice and the NPA is that the number of people who are being employed has decreased. Treasury and departments are constantly looking at ways in order to implement austerity and to reduce their budgets because they're getting reduced budgets. And so one of the areas that's affecting across the board is, of course, the courts. In relation to protection orders, they don't have the number of clerks that they necessarily need or the number of magistrates, which slows down the process at which orders are finalized. But on the other hand, the department doesn't know what it actually costs if you had sufficient people to produce a protection order at a quality standard. So until we get that kind of data, it is not possible to cost and to speak with accuracy and truth as to what your budget actually is. This is perhaps just the budget for what you think court services cost, what you might know a little bit about sexual offences courts, what you might think might be the cost of victim empowerment services in the Department of Social Development's program. I think just to illustrate some of the complexities in a little more detail as to why you need to have that costing, I want to talk a little bit about women's work in the services sector and the impact of budget cuts, and then have a look at the actual impact on budget cuts for shelters themselves. So why I want to highlight this is because the community and social services sector is growing as an employer. In 2010, it was accounting for roughly 20% of all jobs. By 2022, it was accounting for 25% of all jobs. It's now one of the biggest employment sectors in the country. But it is a very gendered sector. If you look, more than a third of women's employment, so a third of women are to be found in gender and the community and social services sector. It's now the sector that employs the greatest proportion of women, and it employs double the number of women versus men. So you can see 17% of men versus 34.9% of women are employed in the sector. If we look at the quarterly labor force data, you can also see the number of jobs that are being lost in the sector, and you can see how volatile the sector is. So in quarter one last year, it lost 122,000 jobs. Quarter two gained 36,000. Quarter three gained 194,000. Quarter four lost 63,000. First quarter of this year lost 98,000 jobs. So this is telling you something about the precarity of women's work in the sector and its volatility. This is very relevant, I think, for Pillar 5 to look at, because while it is putting a lot of its focus and procurement in the sale of women's services, it needs to be looking here as well, because this is a lot of where government funding is going in order to subsidize NPOs to provide these services. And this kind of volatility is not good for women's work. It creates precisely the kind of instability that Professor Delanoy was speaking about earlier. So if we're thinking about gender-based violence, we should be thinking both of those who receive the services, but also those who are providing the services, because if their employment is very unreliable, erratic, and volatile, then that tells us something about how erratic and volatile the quality of services will then be. So if we look at Gauteng, and the social care services are heavily feminized. It's women who use them because they don't necessarily have as much access to medical aid. They don't have the same kind of levels of employment. So that's who they turn to, the public sector. And you can see two-thirds of social welfare service beneficiaries in 2022-23 were women, Half of those who use the Children and Families Program were women, and more than 3/4 of restorative services beneficiaries are women. So if you want to know, so for those who are interested and concerned about disability, have a look at that social welfare services breakdown, because that's where a lot of your disability services are sitting. I'm going to go into a little more detail about the restorative services budgets, which includes the GBV services, in particular shelters. And now you can see how this budget is breaking down and how this budget is also being eroded. And the data here I've taken from DSD figures that they provided at the end of January this year to the provincial legislature in Gauteng for Social Development Portfolio Committee. So it's their own data that I'm using and analyzing and presenting here. So what you can see is, okay, I'll try and wrap up, is what you can see is quite a positive picture of over 35 million going towards women's shelters in, sorry, the top of my screen is just cut off, in 21-22. An overall VEP programs getting 97 billion, so 132.9 million going towards those programs in 2021-22. You can have a look at how it decreased in 2023 and then 2024. So shelters dropped from 35 million to 32 million to 23 million. Slightly more ended up being spent, so it went to 26 million. So you can see that actually the picture in 2021-2022 was better than the picture now in 2024-2025. The other area to also look at is the degree of underspending that's happening in the Tutuzela care programs. This is all NGO funding, by the way. This is not spending on government social workers, it's NGO. So we're looking at, when they first gave this to us in 2023-24, 6.2 million allocated to the TCC programs, just on 2.9 million spent. So 3.2 just not being spent, and would have been part of the money that went back to Treasury. For those who aren't aware of it, roughly R500 million was returned to Treasury by DSD in the last financial year, with over 230 million of that having been allocated towards NPOs, and that was unspent. The TCC programs, again, the most recent financial year, again, look the same pattern, where it has been unspent. Victim-friendly rooms, again, which are dealing with a lot of those who go to police stations to report. Again, we had a problem with under expenditure. Sorry, I hope this hasn't. Sorry, my screen seems to have locked. I'm going to just stop sharing in order to be able to move it on and see if I can get this going again. Sorry. Can you see it again?
Not yet, Lisa.
Okay. All right, looks like it's back.
Yes.
So I'm just going to keep it to this view just so that I've really summarized, is you can see the declines. And again, this in the context where we should apparently be caring more than usual about shelters. The last thing I want to just look at, and it's why when I conclude, I want to say the need to look across government departments and the way in which administrative requirements interfere with the capacity to provide what I would really call, in some ways, is both a responsive service, shelters, but is also preventive service. It not only prevents women from experiencing repeat violence, but also by reducing children's exposure to violence, you are hopefully breaking a cycle of violence and reducing children's exposure to violence and the repetition of cycles of violence as adults. So just very quickly, in relation to the problem of municipal bylaws, is municipalities have bylaws which require you to have building plans, which require you to have a fire evacuation plan, which require you to have culverts and drains built outside a certain distance from your building, which requires you to have no cracks in your tiles, etc., etc. Of course, these are important, but are they a reason to deny women the right to safety and security? So in Gauteng, we've had a situation where you can see, and it's a little bit difficult to always get a clear picture of what's going on, where in Johannesburg, you now have 2 shelters for the entire province. At one point, there was only 1 shelter open. Shelters closed on the West Rand due to municipal bylaw compliance. And in this instance, it was things like building plans. Now, if you are in a building that was designed before 1992, where there was no obligation to have building plans, those building plans will not exist. But the department insists that you then go and spend the money, which can cost up to R500,000 to have an architect draw up those plans from you. Organizations do not have that money. So you can see the issue that, as I said, at one point there was only 1 shelter for the whole of Johannesburg. You had a shelter closed on the West Rand, which was in Florida, close to Soweto, convenient for women living in Soweto. When that shelter was closed, they moved all the women. That was very inconvenient. It was an hour and a half travel for women there and back every day to work. Their children had to be, it was very difficult for their children. They did not want to disturb and uproot. Most of those women who moved to Carletonville then simply moved back to their partners. That is a consequence of when you shut down a shelter, relocate women to places that are very far, you end up encouraging them to basically go home. So, yeah, at the start of this year, there are 3 that are still closed in Johannesburg due to municipal non-compliance. They may be conditionally registered. The discussions are ongoing. There are 2 that will either close or remain closed because one submitted their business plan 3 minutes late and another submitted theirs 10 minutes late. Again, I ask you, is punctuality really important that you are going to deny women their right to safety and security? So these are, I think, the issues that we don't see, but that become obstacles for us to be able to address the problem comprehensively. So just to conclude, I mean, I think that will give you a sense of why the department is also underspending its shelter budget, is because it's got the money, but because it's withholding the funding, it's not being spent and it's going back to Treasury. So just to conclude, what's missing, since I've been talking about shelters, is the Department of Human Settlements. And I do hope the committee would consider calling them. They have a special housing needs policy, which also, of course, deals with housing for which not only has the potential to deal with housing for women who need to exit shelters, because you cannot live in a shelter indefinitely. It also covers the needs of housing for persons with disabilities, for instance. So the special housing needs policy has been developed. The Department of Social Development has been trying to push it, but the Department of Human Settlements, no progress appears to have happened in 3 years in order to push this forward, to develop the costing frameworks, in order to be able to implement it and make a reality. The other department we need to be looking at is the Department of Health. The Domestic Violence Act requires the department to develop directives around how the health sector should be responding to domestic violence. Not there. I've spoken about the municipal bylaws. We need cooperative governance and traditional affairs to get involved in order to help address these problems with municipal bylaws, because every municipality interprets bylaws differently and uses different standards. So what's acceptable on Mogale City may not be acceptable in Tshwane, for instance. And this is a problem across the country. I'm using Gauteng examples, but it's a problem across the country. There needs to be harmonization, because not only does the municipal bylaws differ in interpretation of some of the health legislation, environmental health and safety, but it can also differ with the Department of Social Development's own legislation, such as around children. So you can have 3 or 4 different pieces of law that can lead to a shelter being shut down, or a children's service, or a residential facility for people with disabilities. So there's a need to bring these departments together to talk about how do you present some harmonization so that administrative disagreements don't become a way to deny people rights. The other thing to follow up is what happens to Public Protector's 2024 report. That asked for important norms and standards to be set, which provide the basis for costing, which would provide the basis for a budget. So where that is, by now the Department of Justice and the NPA and the Department of Social Development should have responded in terms of the Public Protector's timeframes. Where is their response? Can we hear what has happened? And then I think I've spoken a bit about thinking critically about budgets. We can't just accept total figures. We need to have the nuance, the detail and the breakdown. And we need to think of, in our current context of austerity that's looking at reducing headcounts, what is that doing to services? And then to sum up, I mentioned earlier, we need to think about what is changing within our environment that appears to be influencing the conditions for violence. Why are we seeing violence increasing in some provinces and not in others? What is happening? I've mentioned how policies potentially undermine each other. And I think the last thing to think about is that when money gets sent back to Treasury unspent, or when we use punctuality as a reason to deny a service, or when we use administrative requirements like building plans to deny people services, then we might want to start thinking and using the language of administered harm, because these are administrative requirements that have been used to deny services or reduce services, and that causes harm. So I think we need to start thinking about how we can, while addressing gender-based violence, simultaneously undermine those efforts by these practices that result in administered harm. So I'm sorry, I've gone a little bit over time, but that was a very quick summary of selected issues of what else we can be thinking about in relation to the NSP in order to make it more effective and to think more broadly. Thank you.
Lisa, thank you so much for your time and for doing that presentation for us. I think it's simply unforgivable. It's criminal that money is set aside for NGOs and then it's returned to Treasury, 500 million of that money. And I think I like the term that you've just mentioned, the administered harm, because at the end of the day, there's no excuse for people not doing what they're supposed to be doing, and then it impacts so severely on the most vulnerable women, youth, and persons with disabilities. We will definitely look into the Public Protector Report of 2024. We will consider calling COCTA to talk to them about the municipal bylaws. And of course, it is important that we speak to the Department of Human Settlements about the special housing needs policy. But please do stay online just for a little bit more so that we can engage with your presentation. I've also got some questions to ask. Can I now hand over to Atini Magodla? And Atini Magodla is a gender fellow and community facilitator and gender assistant at the Center for the Study of Violence and Reconciliation, and is a gender studies master's candidate at the University of Cape Town. And Atini, thank you so much for reaching out to the Portfolio Committee and indicating that you would love to work with this Portfolio Committee and offer some of your insights and expertise to us. So sorry that we've run a little bit over time, and I hand over to you to make your presentation.
Good morning. I'm hoping that I'm audible.
You are. Thank you.
Can you see my screen as well?
Not yet. Are you sharing? There we go. There we go. Thank you. You can proceed.
No problem. Thank you so much, Chair, for the opportunity as well. And as you have introduced me, my name is Atini Magodla, and I am the Gender Assistant and Community Facilitator for CSVR, which stands for the Center for the Study of Violence and Reconciliation. And really I want to touch on, firstly, before I begin, the importance of community engagement and relations within our work. It really forms foundational, for most of our interventions and, even most of our research, quite frankly. So we pride ourselves in having really sort of like a very extensive footprint within South Africa when it comes to community relations. To give a brief introduction of who CSVR is and what CSVR does. So CSVR is an independent NGO founded in 1989 with a clear aim to understand and prevent violence, heal its effects, and build sustainable peace at community level and national level. So through a multidisciplinary approach that encompasses research, advocacy, psychosocial support, all while offering a gendered lens. So it's at CSVR, we don't shy away from the fact that people experience violence through a gendered filter. And so how men and women experience violence is completely different and sometimes similar. And so we hone in into this kind of lens and theory and perspective at CSVR because it really sort of allows us to develop interventions which are very specific to communities and people themselves. So, as I've mentioned, we have a rather a multidisciplinary approach, and our programs encompass research, advocacy, and even psychosocial support. We also have a gender program at CSVR, which is responsible for mainstreaming and offering that gender lens, as I've mentioned. So in research, we have done a number of studies spanning from reproductive health, sexual violence, social cohesion, xenophobia, and even a study on the drivers and the causes of violence. We also have our foot in the sort of northern parts of Africa where we sort of engage transitional justice. We've even quite recently worked within the terrain of boys and masculinity, which, as the previous speakers kind of sort of attested, that we need to be aware as well of emerging themes. And boys and masculinity is one of the very vividly and starkly rising theme when it comes to conversations of, GBV prevention and gender equality overall. There is quite a number of global work that's emerging that's kind of attesting and sort of appreciating men as victims as well, and also kind of looking into more strategic ways of engaging men as allies of gender equality, and basically, deconstructing that norm of masculinities and providing sort of like a nuanced positive masculinity approach in society. One of the emerging themes that we are also recently interested in is technology-facilitated gender-based violence, which is quite an interesting, sort of form of gender-based violence that occurs within the digital space. It is often intangible, and so this violence kind of has a way of metamorphing itself into various forms and on various different platforms as well. And so it becomes really hard for us to hold it accountable because it's often people behind the screens that we cannot often hold accountable as well. And so that's sort of one of our emerging themes and interest recently here at CSVR, particularly within the research element. Again, to emphasize, our research is informed by lived experiences in communities, conveying nuances that often statistical data may not be able to reflect and punctuate. We really are sort of appreciative of the fact that we have access to community members and community stakeholders because it provides us with a very sort of profound opportunity to learn from community workers. We learn from them, they learn from us as well. And often we are appreciative of the fact that they are able to share their lived experiences without often expecting anything else. And what we do, we often sort of package that lived experiences into real data that informs much, much larger work. So again, within our research sort of background, we were one of the very first and few organizations to call violence against women in South Africa a crisis in a study that we did in 2017, which set off a chain of events, including public discussions. And then in 2022, we then published a report titled Lived Experiences and Responses to SGBV. In this report, methodologically, we sort of intervened and interviewed 8 high-risk communities. Furthermore, the study then evidenced the root causes of violences and community-centered interventions. Again, we really believe that strategies and community interventions should come from communities themselves. This sort of provides a very sort of sustainable strategy to prevent violence within communities as well. Interestingly, the data also kind of revealed that gender-based violence really is, in most communities, often just a symptom of a much larger sort of form of violence, which is often structural in itself. So that was one of our most interesting studies of recent. And then, as I've mentioned, we have an MHPSS component, which is mental health, excuse me, which is mental health, psychosocial support work, which focuses on healing trauma. Part of understanding violence is addressing trauma. And we then work on a one-on-one basis with survivors, but we also do community groups. Quite recently, we have a scheduled intergenerational dialogue where it is sort of like a community dialogue, but at a much more intimate level, where we invite women, particularly from different communities, from different generations as well, to kind of have a dialogue exchange of the experiences within the communities and in South Africa at large. And this is often really sort of profound, as it provides learning opportunities for community members, particularly women, between generations. And outside of the dialogues, outside of the intergenerational dialogues, there's also opportunity to build social cohesion, because now, this person is no longer a stranger, and they can sort of take that relationship outside of the community dialogues. And so it's really one part of the strategy to build social cohesion within communities, because cohesive communities are at a better position to respond and prevent violence than communities that are not cohesive. And so that's one of our strategies as well. When it comes to MHPSS, mental health and psychosocial support, we also believe in organizational wellness, right? So that means at times providing grassroots organizations, NGOs, CBOs, and NPOs with capacity training, including police officers, so that they don't become victims of secondary trauma, vicarious trauma, in that they are able to still be there for communities and show up communities while having the capacity to deal with vicarious trauma. So that would be our MHPSS component. And then our advocacy component, which is that we kind of push for laws and policies, so that we're able to connect these laws with communities, right? We also simplify complex GBV laws into more comprehensive languages that then meets the standards of communities, and further sort of workshop and educate people about their rights. Often you would hear that there's a huge tension and disconnect between national laws and how they are implemented and integrated within communities. And so our responsibility there is really to provide communities and community members with a language and sort of infographic that they can understand and take with, when it comes to laws and policies of gender-based violence. And so that would be a part of our advocacy component. And then one of our approaches, as I've mentioned, is really having and centering a trauma-informed healing approach. All of our programs have a trauma-centered approach with an empathetic ethos, right? We recognize that people in our society carry both historical and current trauma that continues to shape and impact their daily lives. We understand that trauma manifests in various ways, right? Including the recreation of violence and perpetuating violence unknowingly, which is often really a surprise to me as a person working in the communities, that people actually really do not know that, they are sort of victims of trauma, and that their way of being have been shaped by their trauma. And so it's easy for us to blame people as sort of criminals and perpetrators, when we then don't understand that people's sort of like perspective and experiences is then shaped by trauma itself and violence in itself, quite frankly. As I've mentioned earlier on, our MHPSS interventions are also, sort of educational grounds where we break down complex individual and community issues into much more sort of understandable and comprehensive issues as well. Again, providing an opportunity for community members to connect through similarities and differences. So that is the sort of slide that I just talked about now when it comes to just the trauma-informed ethos and our holistic empowerment. There's obviously empowerment embedded in our, sort of trauma-informed approaches, and which is one of our sort of greatest strategy. Again, going back to my point of having community relationships. It's a very important part of us learning from the communities as it informs our research papers and so forth, right? So community work is really the heart of most of our work, right? This is often the meat of our work, rather. We not only get to educate community members, but also we tend to help them build resilience For example, as I've mentioned, take the GBV laws and the NSP. Although these are really, really vital, but within communities themselves, in communities, they remain abstract, intangible, and quite frankly, even inaccessible. Most people don't even know these laws exist. And so what we do, we really help communities kind of understand and drive these laws within communities. In other words, really domesticating national laws and policies within communities. And so we work with communities and stakeholders to create locally owned GBV prevention strategies. So what we do, we take the national laws and we then introduce them to the communities and we workshop them into strategies, rather we call them strategies that will then be owned by communities, that will also reflect the life on the ground with communities, that is also sensitive to the culture and the context within communities. And so we do a lot of work workshopping these communities. And, again, this also helps with building social cohesion within communities, because then there's ownership and accountability when it comes to these GBV strategies that they themselves come up with, essentially. So community engagements and relations are not only fundamental for research purposes, but also form part of our groundwork for prevention. This is where we are able to confront social and cultural norms that give permission to violence. So this is often also one of the most difficult parts of our work, where we have to confront social norms and cultural norms as well, which is often very sensitive and often the most difficult part of our work. So when we're talking about prevention, work, we are also referring to education, empowerment, and healing, as I've mentioned. Sorry. Again, really the realities on the ground when it comes to communities, it's quite complex. We understand that in our communities, there's no singular cause of violence. It's multi-layered, it's complicated, it's complex, and that's why we have a multidisciplinary approach. That's why we partner up with stakeholders on the ground as well, because they understand the communities better. And so communities face multiple challenges that collide, including unemployment, hunger and poverty, and even social services are thin within these communities. This is all happening at the backdrop of entrenched inequality, economic stress, and lack of social cohesion. And so while people are really sort of experiencing firsthand and physical violence in some way or the other, they're also experiencing sort of structural violence that sometimes they don't even know how to make sense of, because it's so normalized within the communities. And that's why we talk about empowerment, bringing them to awareness with some of the things that are happening into the communities, because once you're aware, you're at least able to respond. And so CSBR has a very intersectional sort of approach as well. We appreciate the triple threat theory, and we kind of embed that within our approaches as well. We understand that, again, there's no singular form of violence. As a gendered person, you can experience violence through gender. As a racialized person, you can experience violence through your race. There's also structural violence, and there's also economic violence. And so, again, re-emphasizing the importance of having a multidisciplinary approach, but also highlighting the fact that there won't be one singular answer as well for such a complex and myriad of issues. It's complicated. Violence in its nature is complicated, and we come in with that lens and appreciative sort of notion that we're not going to sort of deal with gender-based violence on the surface, even though often that is often the intention, to come and talk about, give a sort of a community dialogue about gender-based violence. But then you would find that communities, or you would find that, justice for most victims is not what they're looking for. They're really looking for something else. They're looking for sort of like an employment opportunity. They're looking for food for their children. They're looking for housing. And so again, if you listen carefully, you would understand that all of these issues are then connected. And so at CSVR, we always come in with that flexibility and multidisciplinary. Again, to emphasize the notion of cultural norms and harmful practices, which is an incredibly challenging part of our work, because touching on people's culture is really, 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 really sort of sensitive. And although we understand that it is important, because again, often the national policies and laws, they don't really appreciate the cultural perspectives and the cultural practices and the social norms on the ground that then give rise to violence and give permission to violence, and even also allow men to construct a violent masculinities, all in the name of culture. And so part of our empowerment strategy is that we have to confront social practices and social norms that are giving rise and giving permission to the perpetuation of violence. For example, we've been in communities, particularly within the Eastern Cape, where women would say that my husband is starting to weaponize lobola against me. And so, again, talking about sort of the possibility of rape within marriage and just physical abuse and any kind of abuse within marriage, which most women would not necessarily kind of have the perspective to even acknowledge. And so those are some of the things that we workshop within communities when it comes to cultural norms and harmful practices. Something as so normal as ukutwala, for example, which is also a theme that comes up within one of our studies. Ukutwala being young children being forced into marriages. In some context, that is absolutely normal, right? But again, if we're looking at the South African laws, what does that say about the South African child and the rights of the child? And so we bring those things to the fore and to the surface, which is incredibly challenging and sensitive. Again, I think one of the most interesting things that really came out when it comes to community engagements and dialogues is men feeling left out. Quite recently, in a dialogue that I had in Delft, a lot of men, one man particularly, but it was echoed amongst the venue as well. He said that he just feels that he no longer has a voice at home. He no longer feels respected by their children as well. And it's all because now the woman within the household is aware, is empowered, and is knowledgeable of their rights and their position in society and what services they have. And so the man says that now he doesn't feel like he's the man of the house, stereotypically speaking, anymore. And this also got me thinking that a lot of the women empowerment work that we have done, or any sort of gender equality work, quite frankly, I'm going to say any kind of gender equality work that we have done has kind of either intentionally or unintentionally omitted men. Given obviously the historical context, we can completely appreciate that. But unfortunately, what that has done, it has then left the men confused. It has left the men behind, quite frankly. Often men then don't feel their position in society. And so what we do within these community dialogues, particularly when it comes with men, we workshop forms of masculinities that mirror modern society. Positive masculinities would be the operative and most popular known term. And so in order to mirror again and to basically have a congruency within modern society, because again, that form of masculinity historically was quite frankly accepted, even encouraged. But then there's also tensions within those community dialogues where men would say that I completely am for positive masculinities, but my peers, my friends, my mates are not going to be accepting of that. And so then there's other tensions as well, that needs to be sort of discussed in that as well. So it becomes really such an interesting conversation. But again, really, I think it hammers the fact that there needs to be a sequencing when it comes to conversations of GBV and gender equality when it comes to men and women, that how do we then think about sort of our interventions that are more focused on both genders? How do we move forward with both genders? How do we ensure that we're empowering the woman without obviously sort of compelling the men to feel frustrated and so forth? And so, again, really notions of masculinities, I think also needs to be discussed at a national level in relations to GBV, in relation to gender equality. I think there's an opportunity for work to be done there as well. Again, one of the reasons why one of the reasons why prevention work is so important is, again, to enhance that social cohesions. A lot of communities, particularly people who are migrants, say that they don't feel safe to report. They don't feel safe walking around within communities. They don't know their neighbors, and they would rather sort of stay quiet, all in the name of just, being part of the community. And then with prevention work as well, is that we try to enhance that element of social cohesion where people are able to speak out about crime, are able to support one another when they are sort of survivors and victims of crime and violence, in GBV particularly. And so social cohesion becomes a crucial element of prevention work. I have briefly spoken about this when it comes to patriarchal values that have informed notions of masculinities and are one of the leading causes to domestic violences as well. I've also briefly discussed this, so I'll just do a little run through. We believe in sustainability at CSVR. We believe in building resilience. And so maintaining community relationships is fundamentally important to us, but we also want communities to be able to strive without our support, essentially. And so what we do as CSVR really is then we sort of anoint community leaders, we provide capacity for GBV ambassadors to be able to exist within communities, so communities can feel safer. And so that's why it's so important to also provide capacity training within our communities as well, and not necessarily just to extract, data from people. So at CSVR, we really have helped several communities draft their own community-centered GBV strategies, as I've mentioned. And creating community patrols, again, really reinforcing and emphasizing that element of having, GBV physical structures and support groups as well. I think that's one of the things that we're really proud of, creating support groups amongst women, because most communities would not necessarily have support groups. And in our dialogues, one of the last things that we would do is bring women together, and then we would sort of create support groups for them. They would often meet whenever it is necessary to discuss community issues, particularly around violence. And these women sort of champion anti-violence strategies together, and then they become sort of like go-to figures for most people as well. So that's one of our really, really proudest things to do. We all know the say that prevention is better than cure, while response is incredibly important. But by redirecting resources to prevention and empowerment, we can save from crisis response. We'll save more money. It is much more expensive to respond than it is to prevent. And so, again, really building that social capital by capacitating community members, community workers, stakeholders within that communities, developing community-centered strategies. Again, just to emphasize the fact that these sort of GBV laws and policies can really be attached between communities, and it becomes important then to be able to domesticate them within communities, so communities can actually own them as well, without feeling like they are the outsider, right? Also just transforming attitudes. This is a very educational element of prevention, making people aware again of their rights, dismantling toxic masculinities, because, I think statistically, as we have seen in the previous presentation, that often it is said that men are the sort of perpetrators of gender-based violence, but often there's very little work that goes into men. And so again, a shift in focus in that as well will be incredibly important when it comes to sort of gender-based violence prevention. I would leave it at that. Thank you so much.
Thank you so much, Atinia. We really appreciate your time and your presentation. Can I check whether there are any honorable members that would like to ask any questions? I know we are out of time, but I do think we have a little bit of time left to engage with these presentations. Can I see if there are any hands?
Yeah, if you can also recognize me, Honorable Chauke. Thank you.
Okay. We'll go with Honorable, it's firstly Honorable Chauke Adonis, then Dr. Leklape, followed by Honorable Mabel. In that order, please.
Thank you very much, Chairperson. And I'd like to just appreciate the presentations that have been made to us and really highlighting quite critical areas of concern, but also providing us some of the interventions that have taken place and the developments. But I think what is equally important is what is highlighted in the presentations as part of intervention, key intervention strategies that should be applied in addressing areas of concern such as GBV, infrastructural support, resource, and also how economic and social factors contribute towards these elements. Chairperson, I think for me, it would be a question of really understanding in terms of the research that is conducted by all three of our presenters. It would really be on understanding the research that is conducted to specific sectors. So segregated collection of data, such as looking at how many gender-based violence and femicide cases are victims are persons with disabilities, because we do find that those are underreported, and usually in terms of statistics, we do not have the necessary data collected. I know that there was a data that was a stat that was released last year, but I think even that is not a true reflection of what is currently happening in South Africa when it comes to cases of gender-based violence and femicide amongst or against persons with disabilities holistically. So one would really want to have an appreciation or understanding what type of research has been conducted along those lines, and perhaps what are some of the interventions that would be then recommended. Lastly, it would be what are some of the recommendations that would then be made for us to ensure that even the work that is being done by the presenters is amplified, and additionally, how do we ensure that the organizations that seek to advocate for women and men's empowerment when it comes to gender-based violence and provide the necessary education to our children in ECD centers and early childhood development institutions are able to gain access to the information? Is this a matter of ensuring that Treasury is adequately allocating resources? The department is playing a more critical oversight. And additionally, I think it's quite important for us to emphasize the importance of fast tracking the establishment of the gender-based violence council. So I'd just like to leave it there. Thank you very much, Chairperson.
Thank you so much, our whip, Dr. Leklape.
Thank you, Chair. And thank you for all the presentations. They're quite insightful. First question, it's about, reading about the origins of the CGE, the struggle of women, and the issue of language barrier in national organizations where people that come from indigenous backgrounds could not express themselves. Is it not time to move from political correctness to pragmatism and providing leadership where it should be English for all? And part of the issue is that in this country, we're going to ensure that everybody understands, reads, and writes English. Because even though we have this issue of political correctness about language, etc., if you're not fluent in English, you get left behind. You can't get a job. You come to Parliament. Most of the deliberations are in English. The translations don't work. People get left behind. So isn't it about time where we become a multilingual country with bilingualism, where everyone needs to understand? Understanding English and speaking English and being able to read it should be a human right, because everything else is in English. Otherwise, your rights are compromised. So I'd just like to hear a comment on that. Now, the NGOs, and unspent monies, wouldn't it be time now that we speak to them, those that provide services, as not-for-profit organizations? But everything should be in order in terms of business skills, being able to run a business, safety. So I become concerned when we have concerns about unspent money, which is legitimate. Shouldn't we have line budgeting so that we know which line item was not spent and there should be accountability for not having spent it? I don't think we could have sympathy for late applications, because if you have rules that you can't apply, you're going to result in lawlessness. If there's a deadline and you say 1 minute is fine, what about 2 minutes? What about 2 days? What rule would you be applying to have that? Should we not be ensuring that the people that run NGOs, that provide services, that get funding from government, are adequately educated to ensure that they must deal with those monies responsibly? So even submitting your application in time is a beginning of responsibility. It might sound harsh, but we need to ensure that we can uphold the rule of law. And once you start making exceptions, you might as well not have laws. Now, intergenerational dialogues. It's for me, what is missing is about national laws informing and reforming institutions. You know, we have a constitution, we have Bill of Rights, we have Section 31 of the Constitution, but things are not done in tandem. We're funding institutions that are violating the tenets of our Constitution. I have no problem with funding traditional institutions, funding COCTA, but they must be funded because they are in line with the Constitution of the country. Because otherwise, you are promoting unconstitutionality. When traditions, whether they are in institutions, they are in culture, they are in religious sector, or they are in society, do not uphold the key tenets of our Constitution, they should not be funded by the state. And there should be a clear program to reform them in line with the promises of the Constitution. I become concerned when I hear a comment that ukutwala is normal. Ukutwala is patriarchy. It's not normal. And we need to state it up front that all those things that demean and devalue women are unconstitutional, are unlawful, and should not be funded and should be confronted. When you hear a woman complain about lobola being weaponized against them, then we need to reform that institute of lobola. What is it meant for? Anything that turns women into property should be reformed and eventually outlawed if it turns women into commodities. Because these are all the issues on which GBV is going to be based. And for me, now that we have 3 experts that speak on some of these issues, I would like advice from you. Because part of the things that create atrocities comes from simple language that is demeaning, that becomes allowed, that becomes the norm. We've just had the issue of the McG, and the McG issue should be an insult to all women. And it should not be left to the particular person that was targeted to defend themselves or to educate men about certain language will not be tolerated in this democracy. Can we still pursue that so that that lesson should be made? Because that apology should be to all women. That apology should be to all of society. Because that behavior from that fellow man is unacceptable and should be brought to book in terms of the public perspective. So I'd just like to hear, because we can't be having these community dialogues that don't confront the elephant in the room of toxic masculinity that is embedded in traditions and cultures. They need to be confronted, and they need to be told, not in this democracy, not in this time, not in our name, so that women can rise. Thank you, Chair.
Thank you, Doc. Honorable Mabel.
Thank you very much, Honorable Chair. I'm a little bit covered on other presentations, but mine will focus on Commission on Gender Equity. Honorable Chair, historical overview of feminist activism leading to the Commission on Gender Equality within South Africa, National Gender Missionary. It highlights successes, women budget initiatives independent, Chapter 9 mandate, but notes unresolved sexism and marginalization of grassroots women. And it identifies structural tensions, unclear CGE, OSW roles, misalignment between CGE, Act 39 of 1996, and the Constitution, limited resources and partisan interference. And reports minimal progress on gender-based violence, poverty and unemployment despite decades of CGE operations. And my questions, what timelines exist to amend the CGE Act so it fully aligns with the Constitution and clarifies mandates relative to the office or on the status of women? How will Treasury address the CGE's chronic budget shortfalls and salary parity gap with the SARC? Of the CGE recommendations tabled in Parliament since 2015, how many resulted in legislative change, and what follow-up mechanism tracks implementations? What disciplinary process applies when commissioners' party loyalties hinder impartial oversight, as alleged in the 2004 sexual harassment case? How will the department measure CGE impact on GBV reduction beyond annual awareness events? And Chair, when I ask questions here as an opposition party, not as a part of the GNU. Ote, how do I ask questions? I think I have to ask questions the way I want to ask questions. Thank you. I submit.
Yeah, Honourable Member, you are very free to ask any question, and I'm always an advocate for people being allowed to give whatever inputs they want to give. But we must just remember that when we come to this portfolio committee, we're also one portfolio committee, and we jointly share the responsibility of the interests of women, youth, and persons with disabilities. But I've never not allowed you to ask all the questions that you want to ask, Honourable Member. I take it you are done, or do you want to continue?
No, I submit, Honourable Chair. Thank you.
Thank you very much. I just quickly wanted to ask one or two questions before we hand over to the presenters to respond to us. Mine will be to Ms. Vetten. Ms. Vetten, in one of our meetings with the MEC for Social Development in Gauteng, she had made a very strong statement that things have changed, that what we are talking to her about is old issues, that there are no problems with NGOs anymore, no problems with non-payment or late payment or underfunding of NGOs and NPOs. So really my question is, if that is the case, then why is $500 million still returned to Treasury? Does this mean she misled Parliament when she gave us those responses? If you can maybe just give us your view, because she was very dismissive of our concerns with regards to the challenges that NGOs and NPOs are facing. Last week, with our engagements with the department around our own department, Women, Youth and Persons with Disabilities, around the National Strategic Plan,
a question was asked around accountability. In other words, there were some departments that were not meeting, they were meeting very low targets in terms of their responsibilities in terms of meeting the NSP targets. And it seemed that when we were asking about accountability, the response was just simply that we as departments don't hold each other accountable. And that was really not what we were asking. So do you think departments are really doing the basics in terms of their obligations in meeting the NSP? And do you think the NSP is a well-crafted plan? Will it really make any difference in the fight against gender-based violence for the remainder of the 3 years? I know the plan runs until 2028. And with regards to your statistics around the justice system and how they're failing women, I think it's quite shocking. And again, my question really is, if this is the status quo, if we cannot prosecute rapists, do you think that we will ever really, will a document such as the NSP really make a difference if that is the status quo in terms of the justice system? You did mention the Omotoso case. To Prof. Gertrude, I simply want to ask you, Prof, as an outsider now, well, not an outsider, you're still an activist, but what is your impression of the Commission for Gender Equality, the Commission for Gender Equality? Do you think it's really meeting its targets? Is it successful in driving its mandate? Is it visible? Yeah, if not, why not? Do you think it's simply a budget issue, or do you think it's a leadership issue? And thank you so much. Let me hand over back to the presenters. I think we'll start with Prof. Gertrude and then go to Lisa and then to Atini, please.
Thanks sorry, I'm trying to unmute myself. Thanks very much for those questions, and also to the other presenters. It's been very illuminating, and I've also learned quite a lot. So thank you very much for this opportunity. I now just want to look at the questions with the honourable member, I think it's Charco Adonis, which she spoke about research. Now, we have mentioned time and again the fact that the data is not disaggregated. We never can discriminate and work out what precisely is the issue around people with disabilities, people in rural areas, people in marginalized areas. So the data is actually sometimes very skewed. I would like to appeal for maybe a more concrete and dynamic relationship with the Medical Research Council, University Research, Stats SA, and also your work as parliamentarians. How do we actually work together optimally to get and share information, share, I will do this, you do that, etc., etc. Oh, there's also HSRC. So there's a lot of money going into research, honourable members, but the question that I have is, are we using it optimally? And are we sharing our data? Are we looking at what the gaps are? And I mean, it's quite ironic when I write a paper sometimes, and every time I get the quotation, especially how African statistics in Africa is either minimal or skewed or not actually accessible. So how can we as South Africans and Africans in general maybe promote a more conducive relationship with all our institutions? There's quite a lot of money for funding, but how are we using that for research? And as I say, for me, the key thing is to build dynamic relationships with your parliamentary committee, with Parliament in general, and our universities and these different institutions like the MRC, who are all doing sterling work, but maybe we're working in silos. That's my comment. Then secondly, I'm just looking at my notes. I tried to just write there. Dr. Letapo, the readings and origins and promoting English and advocating English. And I just feel that what we tried to do, now even in the 1980s, when we had our meetings, I know that it's pragmatic to use English, but aren't we as a society, as a country, as different cultures, going to be the poorer if we're not using our indigenous languages? And there is quite a lot being done. For example, I'm a writer and I looked at some of the scholarships. There are scholarships for writing in indigenous languages only. So there is an attempt. Then how do we balance the attempt of promoting these wonderful languages and the richness of our culture together with being pragmatic? I think there needs to be a balance. It's quite ironic that we're using the colonizers' language, but yes, it is pragmatic. But I do think we mustn't actually negate the richness of our own culture, and that's my very personal personal point of view, but also someone who actually has been an English and drama teacher before I was involved in formal politics. So I think that and then there's a question of Dr. Klapa, also the unspent money. It's not so much just the NGOs, and it coincides with a question by the Honourable Chair, that it's actually the departments that are also, I mean, for me, one of the first things I remember was when we were doing monitoring, that 600 million of the education department in KZN was returned in a province where there are hardly buildings, where there are sometimes schools under trees, where there were pit latrines. I mean, how do we monitor, and how do we actually, when we talk about Batupelo, how do we really inject into our service deliveries, into our departments, the passion that they actually need to service our communities, our societies? Why is it, and also, I know that local government has been given really poor reports of how they're using. Why are we not actually assisting and assessing? Look, if this department or this has not actually delivered, what are we doing about it? So there's almost, I must say, a little bit of a concern how we're not actually holding people to account. That is a problem. And what do we do about it? Intergenerational funding and interventional dialogue, that's very important. But again, the funding institutions are not upholding the constitution. I think that's where we must do our monitoring, that we must actually assess. How can we give money to NGOs or NPOs that are not upholding the constitution? There's quite a strict form. I'm trying to cut my responses short because I don't want to take off from the other people's time, and I'm mindful that the time actually has expired. And so how do we do that? We need to, the funding cannot be given to organizations that not, and it's true, I agree with Dr. Klapa, there should be more community dialogues confronting toxic masculinity. I must say that was, for me, going to rural areas, I think that was one of the most exciting parts of being a commissioner, hearing how people are speaking in the rural areas, listening to how they are resolving their own issues and how we can support them. So communities are not passive. They actually are challenging, and that for me is very laudable. Honourable Mabel, I think that you probably didn't hear what I said. The Act has now been, there's amended CGE Act of 2013. So the Act has now been aligned with the CGE. When we gave reports to Parliament, every year there was the issue of salary parity, etc. It has gone unnoticed. So yes, there have been, and I think that was one of the disappointments as a commissioner. We do monitoring, education, promotion of gender equality, and we also had lots of complaints which we addressed, sexual harassment. We even had a complaint about men feeling marginalized, and we dealt with that quite well. But what I want to say is that all our submissions to Parliament, and annually we had, as a commissioner then until 2022, 2006, we gave submissions to Parliament. Either Parliament's agenda was too difficult, was too heavy, was too challenging, but I'm trying to think now, but I can't think of one case where our issues that we brought to Parliament was actually addressed. And then the impression by the chair that she asked, what is my impression about the visibility of the CGE? I want to be generous and not too critical. I want to say that even in our time as CGE, we tried to have a dynamic relationship with media. We need to see how do we engage media? How do we engage the different forms of communication? And I must say that the radio and the community radio stations in the indigenous languages, for me, that really worked. And I really, and it was, I think SABC was actually challenged. What are they doing to promote gender equality? And that is when they gave us the slots. It's no longer for the English and Afrikaans radio, and I'm not sure of the other radio stations, but I do believe that the radio is a dynamic medium to use. I also think that there's a lot on social media, but I do think we should have dynamic relations with the media because we do not always get covered. We do not always know what is happening with the CGE. How do we really assist them and facilitate that they must raise their profile? And I say I'm saying it with caution and also with respect, knowing that there are many challenges that the CGE has. Thank you very much. I hope I've responded to most of the questions that were directed to me.
Thank you so much, Prof. Ms. Vetten?
Yes. I think the question about statistics in relation to persons with disabilities are very definitely lacking. The one thing that the HSRC prevalence survey was very good on was that it actually did include and ask women with disabilities about their experiences of violence. I don't think enough studies do enough about distinguishing between the different kinds of disabilities. And we also often leave out those with intellectual disabilities because from a research perspective, there are difficulties and ethical questions around obtaining consent. But I think once you start talking about femicide or homicide data, I honestly don't think there's been any count at all of the number of women with disabilities who are murdered. So I think that is quite a big gap to think about and talk about. I mean, I think the other area, to go back to intellectual disabilities, where it would be well worth the committee also intervening, is, to ask the NPA and the Department of Justice and the Department of Social Development what they've done to implement a program like, Cape Mental Health has a very good tested, evaluated program around how it assists those with intellectual disabilities and their families to prepare for court. Because if you have an intellectual disability and you lay a rape charge, the chances of your case going to court are extremely slim, on the basis or the perception that you will be an unreliable witness, that you will not be very credible. And Cape Mental Health has shown that if you sufficiently prepare families and their witness and the actual complainants themselves, they actually get a good conviction rate. You can actually see over the years that they've monitored this, that they've run their program, that you can see in the courts they've worked that there has been an increase in convictions of victims with intellectual disabilities. So it's a really important thing to push for, because we have chapters of the Sexual Offences and Related Matters Amendment Act that deal with people with intellectual disabilities, but it hasn't translated into any recognition as to how you need to actually change procedures in order to accommodate people so that they have their chance of justice just like everybody else. So yes, there's a lot more work that needs to be done around disability, that also needs to acknowledge that different disabilities require different kinds of responses in some instances. And I've used the example of intellectual disability. The question of unspent money. The unspent money here is by the department. It's not by NGOs. So anything that's not spent is money that departments do not spend for whatever reason. So the 500 million that I'm speaking about was in 2024, 2025. That went back to Treasury, not recovered. This year, and here I'm going to go again, the data I referred to, that was provided by Gauteng Social Development to the Gauteng Provincial Legislature. So as at 31st of January, which meant they still had 2 months left to spend, their budget for the year was 2.1 billion for NGOs, and they'd spent 1.7 billion. So they were still roughly 300 million under. Perhaps they've managed to squeeze all of that, squeeze spending that in the last 2 months of 2024, 2025. I don't know. We'll have to wait and see for when the audited annual report is returned, is to see how much they returned. So underspending there, and here I think it goes to this question of holding everybody to the same standards. So if you don't spend your money, what does that say about your management of a budget and a program? That's the first question to ask. And I'm going to just pick up here on responding to your question about how the department has done this year in ensuring that we don't have the same kind of intense difficulties that we experienced in 2023, 24 and 2024, 2025. I think just to put this in, to put payment dates in 2025, 26 in perspective, it's useful to look back at the 2 years I mentioned. So by the 4th of May in 2023, the Premier then had to intervene because nobody had been paid and budgets had been cut. So on the 4th of May, he already then was intervening to apologize and say that the correct steps would be taken, and by the end of May, NGOs would be paid. Last year in 2024, he stepped in on the 12th of May to apologize for contracts not having been issued. Payments began by the beginning of June. This year, the department issued a press release saying it was going to start payments on the 29th of April. It then issued another statement on the 5th of May saying there'd been a delay. And so the first payments only came in on the 9th of May. So unfortunately, if we look at this history of the previous 2 years, the department might have gotten better at issuing service level agreements earlier, but it certainly wasn't paying in April. I mean, if we're going to take a measure, not mine, but the National Department of Social Development sector funding policy, then actually you should have told organizations by the end of January whether or not you're going to renew their funding. So that they've got time to do things. You don't issue the contract 2 weeks into the new financial year. What happened this year? Contracts only started being issued on the 15th of April. So obviously, if you issue contracts that late, you're going to delay payment. So yes, there may have been some improvement, but it's certainly not in line with what policy requires. And this takes me, I think, to my response to MP Letlape, is why would we allow the department so much slack and yet at the same time excuse their rather punitive approach to NGOs? I think the one thing to bear in mind here is that time frame, strict time deadlines belong with when you tender. When you're doing supply chain management and when you're doing procurement, then time does matter. You issue a tender, there's a cut-off time. If you don't meet it, too bad. NGOs, however, do not tender. The provision of services is not a question of procurement and supply. It belongs in terms of treasury classifications in relation to transfers and subsidies. So you do not have to be registered on the central supplier database because the department is not procuring a service. Put in place, so to treat the submission of a business plan like a tender is already wrong. And then to say, oh, well, we paid 8 days late, but that's later than we said we would, but that's fine, and we're very sorry, and it won't happen again. How do you excuse and justify that versus you were 3 minutes late in a process that shouldn't even actually be run like a tender? I mean, that's the thing those are the things that need to be thought about. The other thing that also needs to be thought about is if we talk about shelters, the reason why those shelters were treated as non-compliant, it was on the basis of the Victim Support Services Bill. So in other words, the Department of Social Development was applying standards that exist in draft form only. They are in a bill, not even a law. So that is the first problem, is that they weren't even applying what you would regard as the standards that the law requires. So that's the first problem. The second problem is that it's well within the department's power to do things like, and they do this and they certainly do this in relation, because this is allowed for, it is legislated for, they've done this in relation to children's services. You can have what's called conditional registration. And that means you can be registered in terms of for a 12-month period while you sort out the double glazing that you must have on your windows. Frankly, my home is not municipal. It doesn't meet municipal standards because I don't have double glazing. But nonetheless, if you are a CYCC, you are required to have that kind of glazing on your windows. And what the department then said after some negotiation with them is, we'll give you conditional registration and you have 12 months because it's very expensive to put that kind of glazing on your windows. We'll give you 12 months in which to do that. And if you haven't done it by then, we withdraw your registration. So there are perfectly lawful ways to get around this, because the thing we must never forget is that South Africa is not Europe. It's not the US. It's not it's not an upper income country. We're a developing country, and we must take a developmental approach in terms of, I think, assisting people to meet standards. We don't immediately resort to what is punitive. You may have a different opinion, but I would argue, and I mean the early childhood development sector also argues this, is that we need to take a developmental approach, given the fact that unless you want to exclude the vast majority of organizations from operating as NGOs, just from the question of finances, you need to provide the necessary support to enable organizations to reach the standards that you'd want, appropriate support, but you also have to provide the funding in order for them to be able to achieve these particular kinds of standards. I mean, many facilities are in townships. They were built under apartheid. They don't meet particular kinds of standards. They don't meet the kinds of standards that the municipalities want to impose now. Where is the money going to come from to assist those particular organizations? So I think so my response would really be that we need to be thinking in a much more developmental way about how do we help people to progressively reach what we want them to do. What is a minimum that's not going to obviously put people's lives at risk? And I must be honest, I don't think not having double glazing on your windows puts anyone's life at risk. But how do we get them to move towards something like that? And again, the question, as I said, is what kind of double standard are we allowing? That if you are late, you lose your funding and a shelter shuts down in Johannesburg. But if we are days late with paying you, we just say, oh, we're very, very sorry. So, I mean, I think there's a question here of standards, of being fair in the way that we do things, that we don't say there's one standard for us as government and another standard for you as NGOs, and the standard for you is higher than we hold ourselves to. So I hope that has answered your questions.
Lisa, I still asked about the NSP, whether you think
Oh, right, yes. You know, I think this is not to dismiss the enormous amount of work that went into it. And obviously, sometimes you can only see limitations with something after you've implemented. Nobody has foresight and can see how things are going to unfold. So sometimes you do only see the limitations afterwards. So I think one of the very clear difficulty is the assumptions that are made about government administration and capacity. So the example I was giving about protection orders in the courts, it is very, very hard for a department to do a good job when court buildings are collapsing around them and you have to shut the court because it's unsafe, because there's no water, because there's no electricity, because CETA doesn't work, the network doesn't work because you don't have enough, because there have been budget cuts and so you don't have enough clerks and you don't have enough magistrates and you don't have enough prosecutors. That is a government-wide problem. So to expect that the NSP is going to do well in that kind of context, I think is missing the broader problem. So there are things that I think need to be thought of. So, I mean, some of the things that I think the NSP attributes to failures of social norms, I think in many ways are often actually real problems of administration that we really need to get to grips with and to understand what's happening. And I think when we are currently in austerity, it does mean you have to start thinking about, well, what do we prioritize? What is it that we should really push back hard on Treasury and say, you cannot cut this at all. You can cut this, but you cannot cut that. Where are the programs where we don't really have much in the way of demonstrated impact, so perhaps they could go onto the back burner for a while. So I think it means approaching what we do with the NSP in its current form in a much more critical way in terms of, I think, what sort of hard choices do we need to make? What are the limits of government capacity right now that we can realistically ask for? I would also think that they could have made much better use of data in terms of looking at what is going on, in terms of trying to understand what is going on. I think some of our interventions, we should really take into account the fact that different things are happening in different provinces. So our data could be telling us much more about why is Limpopo so different to the Eastern Cape. They're both in the same country, both have the same grown up with the same lack of resources. Limpopo is poorer, just like Eastern Cape. But why is there so much less violence in Limpopo? So I think we could be doing a lot more to try to understand what are the differences between provinces. Because they've all grown up in the same patriarchal society, but they're different. So what is it that we can learn in order to try and shift what can we learn? Because there's something we haven't thought about quite clearly that's going on, that's producing these differences in statistics. So my sense would be that the NSP would also have to move beyond just focusing on gender norms and taking a much more as a way of shifting things, but is taking paying much closer attention to socioeconomic conditions, how these alter, how these vary, how they intersect with violence, what do they do to change violence, etc. I would also trim the NSP because sometimes doing less is more. You can have greater impact with doing less. Many of the indicators and outcomes could also be tightened up very significantly. And I think, one could also make use of, I don't think government departments use the intergovernmental relations framework enough. That is something that allows for you to start opening up doorways between different departments to try to get them to link in and work with you. It was something we tried to look at with the shelter policy, because sheltering cannot just be the responsibility of the Department of Social Development. You need housing, you need labor, you need health, you need a whole range of government departments and justice to get brought in. So I don't think the intergovernmental relations framework has been looked at enough in terms of how do you pull departments in to working collaboratively on something. So I think that's an explored option. But at the end of the day, I think it is true that the Department of Justice cannot tell the police what to do. The people who have slightly more power would be Parliament. So I think some of those mechanisms need to be given much more thought. And as I said, I think the one to start thinking about would be the intergovernmental relations framework. And the other thing to look at is the CGE. I mean, the CGE does have somewhat more. The CGE is a Chapter 9 institution. So it does have things like the powers of subpoena, the powers of witness. I think it should be playing more of a role in oversight in some ways in the Department of Women, Youth and People with Disabilities, because they run into the problem of one government department asking another government department to do something. The CGE can use those powers of subpoena and say, come here and tell us what you're doing. Give us your information. So I think there are different ways to think about this. I do not, unfortunately, think the council is the answer. If you read that legislation, it runs into exactly the same problems. It's really just a board. I think if you want to think about accountability, it's going to need to be thought about differently. I don't know if that answers your question, Chair.
Yes, it does. Thank you so much, Lisa. And I think the problem that we're going to run into with the National Council is it's probably not going to have the funds that is required. Yeah, and more than that, I think that is why I keep on harping on the issue of the CGE and whether it's functioning as it should, because I think we do need a more robust CGE. It's got the powers to hold people to account. But yeah, thank you for those reflections, and I'm sure we'll continue talking during the 7th administration. Atini Magotla.
Thanks, Chair. And I think Lisa has actually kind of touched on everything that I really wanted to talk about, and I don't want to sound too iterative. But again, really just to emphasize that there's something that we can learn really from the differences within different provinces. Again, I think it speaks to the fact that we cannot have one sort of main national intervention sort of domesticated within different provinces. It is important, it's quite paramount that we go into different provinces and do sort of like a contextual analysis of, what is currently happening within that province, what are the sort of pervasive forms of violences within that province, and therefore interventions can then be informed by that contextual analysis. Again, really communities and provinces are dynamic, and they diverse, and they vary amongst different provinces as well. And we cannot say because we come from the same history that we will then sort of have one overarching intervention and strategy, but really think about how can we tailor each intervention into different forms of interventions on a provincial level, and perhaps even at a much more smaller, more detailed community level. And so really having that kind of like very detailed approach. And I think as well, just, in the conversation of underreporting and stats and so forth, I think also one of the issues that really we have sort of seen within communities and at CSVR is that people have no trust when it comes to like SAPs, for example. They don't feel that justice will be served. And especially at a national level where, for example, the case of Timothy, what's his name? The pastor, or forgot his name, where,
Yeah,
yeah,
Omotoso.
Omatoso, correct. Thank you. In cases like that, where at a national level, it is conveyed that, South Africa doesn't really have a sort of strict sort of sanction when it comes to gender-based violence and any other forms of violence, I suppose, under the category of violence. That is a vivid picture to women who have suffered and are most likely to experience violence that, even if they do report, that there's a likelihood that their cases will not move forward, or quite frankly, won't even get the taste of justice. And even perhaps even further thinking about what justice is for a woman who is a victim of that kind of violence. It may look different from, woman to woman. And I think also when it comes to interventions, Prof has kind of anchored on the importance of collaboration, so I won't touch on that a little bit more, but also really thinking about interventions when it comes to correctional services. What are the interventions for offenders of gender-based violence and sexual violence inside prison? Because these men essentially, and I say men stereotypically because data tells us that they are, mainly the perpetrators of violence. These sort of perpetrators, I should rather say, they then come back into society, and then they still sort of they hold the same perspectives and sort of same values when it comes to women. Mac G, for example, no matter how many times has been made to apologize, he kind of regurgitates the same mistakes, and I put it in quotes, because there is a patriarchal system that supports his views, and he knows that, right? And so dismantling that, sort of giving time and resources to notions of patriarchy, to notions of culture, again, back to my representation per se, that give permission to gender-based violence and any kind of violence. It's really fundamentally the onset of violence. It's these perceptions that we have that are justified through cultures that also deserve its own time and resources. Again, really a connection with communities. It shouldn't be that governmental arms and organizations are detached from communities, because that's really one way of really knowing. Thank you.
Thank you very much. I know we are completely out of time, and I think it's a very sobering way to end off our day with you reminding us that many people don't think that they will ever see justice. They won't get a taste of justice. And in fact, I was listening to discussions on Friday with the Portfolio Committee of Justice, and all honourable members decried the fact that the Omotoso case, in fact, might be a deterrent going forward for women to come forward to report their cases, their GBV cases, because justice was not served. And so that is really a very painful reminder of the reality that we face. I think with regards to the NSP, and Lisa, just listening to what you had said, I think the sixth administration of Parliament made a mistake in that at that time, there was a discussion around having a standalone portfolio committee to oversee the NSP. And I really do think as a portfolio committee, I think at our workshop that we'll be having next week, we need to maybe interrogate that, and whether it's not a proposal that will actually help us going forward. Because considering the work that we are doing, I just feel that there's not enough oversight over the NSP and what different departments are supposed to be doing. But honourable members, we are out of time now. I know you need to run to the National Assembly. I want to thank all of you for your robust engagement this morning. I want to thank our research and support team for putting together this stakeholder engagement. To our stakeholders, thank you again. I think I've said it, thank yous 1,000 times this morning, but thank you for your wisdom, your passion, your insights. Thank you for the good work that you are doing in your different corners, whether it's at UCT, at WITS, whether it's at the Child Law Centre, on your various spaces. Thank you very much for the good work that you are doing. I think we've learned a lot this morning. I think it is the basis, or it will form the basis, your insights and observations will form the basis of the work that we will do next week as we start to look at our focus areas for the rest of our term. I think I've heard a lot around collaboration that is important, the need for us to review laws, the need for us to be more robust in our oversight and engagements, but we will definitely be taking all of your presentations and interrogating them further as we start to chart our focus areas and vision for us as a portfolio committee going forward. We acknowledge that we've got a lot of work to do, and that women, youth and persons with disabilities rely on us, and we take our job very seriously. But honourable members, we will meet in person then next week for our strategic session in Cape Town. Mr. Mdumizweni will communicate the details. So see you then, and until then, our meeting is now adjourned. Thank you, colleagues.
Thank you, Chair.
Thank you.
Long live
Thank you,
the Chair.
everybody.
Thank
Thank
you.
you. Bye.
Thank you,
Bye.
Chair.
Thank you.
Bye. Thank you.
Bye.
Bye. Thank you, Doc.
Thank you, Chair. Bye-bye.
Thank you, Mama.
Thank you.
Thank you.
Thank you, Lena.